This is my first time, you guys.
Think we're good?
Yes.
Okay, well, let's go ahead and get started. Thank you, everybody, for joining tonight's Central School District Board working meeting. This particular meeting was actually originally scheduled for February, and it was one of our quarterly PLC meetings where the board for, I think going back 3 or 4 years now, has been meeting quarterly, doing our own professional development and talking about, just taking some time to learn more about what's going on in the buildings, learn more about how to be good board members and those types of things. I think at our, right after the holiday break when we came back, we decided to pull this meeting up into January and extend the audience because there are so many things now going on with the change in direction from the governor, the ability for school districts to make decisions to start again. I felt it was a good time to just pull this group together and just talk through it. And so that's really the spirit of tonight. I have been talking to Jen just about every night. Last night, Jan and I were able to meet with board members from other school districts, really trying to get a sense of how other school districts are going about the same thing. There's definitely, strong community sentiment to start schools, but in our particular case, we still have very high case rates. There's, issues with vaccine distribution. There's, just as of Tuesday, new guidance that has come out. So we're trying to make sense of all that. So tonight we're going to share as much information as we can. We're going to, answer questions, and towards the end of the meeting, see if we can align on kind of our general thinking on when we should be thinking about restarting, but to really do this together. So, appreciate all our union reps being with us tonight. Appreciate Polk County being with us tonight, Polk County Health. And, I would offer that, to do this, we're going to have to do it together. And that's been my theme and what I've talked to Jennifer about every step of the way. We've got to do this together. So I'm really happy with, so far what we've been able to do together. And now it's going to get to be, pretty interesting and probably messy from time to time as we figure out how to start bringing back kids. And I don't say that because I want to start next week, but it is inevitable. So we gotta figure it out. Last night in the board or the multi-district meeting that I mentioned, McMinnville was there, Newburgh, Tigard, was that it? And then OSBA. I was mentioning the fact that we had done a community committee meeting last week, that, we had been talking like daily with Polk County Health and really working on the vaccine. When I say we, I'm mostly meaning Jen. And then I was mentioning how we were coming together tonight as, this cross-functional body, the whole kind of team that needs to figure this out. And I think I kind of stunned the counterparts on the call because nobody else is doing that. So again, kudos to everybody for being willing to come together and try to do it this way. If we can do this, I think we may be the first school district in the state that's been able to come together and work in a partnership to figure this out. And we may need to do this multiple times because I don't know that we can get through today's or tonight's discussion with so many different moving parts and actually get to clear consensus or decisions. So if we want to do it again, we can, so that's the spirit of tonight. And with that, I'll turn it over to Jen to talk about the agenda. And then the first thing we're going to do is dive into, what's happening with the coronavirus in our county, and also talk about vaccines and just make sure that all of our questions about that are answered. We're certainly getting a lot of questions from the public about it. And, it's a big piece of needing to understand it as we start to figure out where to go from here. So over to you, Jen.
Thanks, Steve. And I, again, want to reiterate, I say this a lot, and many of you in meetings, I am blessed to have this team. I really mean that, with the not only the administration within our school district, but the leadership within our unions, and then obviously the partnerships, obviously tonight with Polk County, who to some degree we have been in conversations with over the summer, but really since the changes that with when the governor had her announcement December 23rd, Jackie and I may talk multiple times a day, and I know Christy at times, if we are working through things in the school district, is even in connection with Jason Clark, and really on the school side of things. So I'm really appreciative of having them here tonight to share, and I'm gonna share my screen to start the presentation. I will start with the agenda, and as I always do, and many of you that are in meetings with me, especially when we do PLC with the board, I ground us in our goals and vision, because that's really important. Even as we are in these difficult times, those are the decisions and the goals that we are trying to accomplish holistically in the school district. So I'm going to take a minute to do that, and then we'll get into the presentation. To some degree, myself, Jackie, and Christy are sort of co-presenting, because there is some guidance, and then we want to just share some things from the data perspective moving forward. So here we go. And everybody can see that. Oops. You know, when you hit the wrong button, my apologies. Let's try that again. Everybody can see that it's a black screen right there. Yes. So here's what we're going to cover today. As I said, we'll start with the goals. We are going to spend some time with the health department. Again, I'm going to talk a little bit about the focus from the Ready School Safe Learners guidance. We are going to talk about on-site testing, which is a new part of the guidance, which we'll share a little bit more. And again, I think Jackie and Christy will share sort of this is what it might look like. And we can talk through what that process would look like on site. We're going to go through some of the new advisory metrics that were released with the guidance, go over our current Polk County metrics, look even deeper at our current Monmouth and Independence metrics, and then talk a little bit about the vaccine process. And then we're going to pause there. Then we'll go into successfully reopening the schools, and we're going to do an update. As a reminder, there are 8 different sections in that. We're going to highlight some of the new changes that are there. We do have in there liability insurance, and we'll talk a little bit more about that, because Steve has some additional information, and we'll continue to work through that. And then the last part is really looking at the framework for reopening, and really looking at that in person. And I'm going to use the word as a starting point, limited in-person implementation, and there's differences of that. So that's a key phrasing, and we'll talk through that. And then we'll talk about next steps, and then what current follow-up meetings we have, and then open up for questions. So that is our agenda for tonight. Again, as I do every time especially in our board workshops and PLC, I ground us in what our goals and vision are for the school district. Again, first and foremost, that student growth and achievement, that how we continue to engage, support, and challenge, and prepare children as whole children. Again, so they are successful not only in school, but their career, college, and within the community. Our second goal, which we all know very much, is family involvement, and this has been crucial as they have been great partners. Not that families have not been before, but they are truly great partners as we've worked through the pandemic, and how we continue to build those relationships with our families. So we are moving forward, and everyone's welcome, supported, safe, and valued. Third, again, part of that, the community partnerships that we have, and I, again, with the community partner that is on tonight with Polk County Health, I cannot say enough about them. They are helping to cultivate so we can get to student success for a safe and healthy. To be very honest, that is their goal. They are in charge of public health. So we're excited to have them with us tonight. And then finally, I am blessed. I think I have the best staff from both of our unions to our administrative team, and what they do from a leadership perspective, and their continuous improvement process really focused on students, their growth, and again, not only academically, but that social emotional, which a lot has been the focus throughout this year as we move forward. So again, just grounding us there as we start. And I'm going to start here because I think as you open up into the guidance for really that we're following, I think the key thing is how do we maintain health and safety and just these continued truths that are really in the guidance of Ready Schools, Safe Learners. You've heard Dr. Fauci say we don't make the timeline, the virus makes the timeline. I think that we are still in some of those stages as we talk, and I think Jackie and Christy are going to talk until we can get that widespread immunity. We're still going to be working through this for many months. We know the tools of the physical distancing, the face covering, and the good hygiene are part of that process, which we continue to have in our buildings throughout the district. And then I think the last piece, every health restriction lifted can increase those transmission opportunities. So again, that is at the forefront of the guidance. That has been at the forefront of this guidance since Oregon Department of Ed shared this with us, and those are articulated to us really every time we meet with the Oregon Department of Education. So I just want to do a quick introduction. With us tonight is Jackie Olmstead. She is the Public Health Administrator, and again, a great partner from Polk County Health. The second is Christy Polanco. She is a epidemiologist and the preparedness coordinator, and I say really the school connection. She is the one that we are, as well as many others that we talk with if we are working through things. And I've added this quote that comes from Ready Schools, Safe Learners, that they're a critical component of our operation as we think about going back into school, both on site. And again, you're going to hear me talk a lot about limited in person tonight, and then how we work towards what that would look like, because they're a big part of the guidance. I want to be clear, I'm the one that makes final decisions in collaboration with everyone that's in this meeting tonight, but they are a thought partner and do give me guidance at times when we are dealing with some critical things, especially as we look at data. I think the other thing that you'll hear throughout as we start here is that as we implement this, we know that there are going to be things that we have to consider that really focus on the level of risk. And so just as an example, we talk about the physical distancing of doing that. When we started our original limited in person in the small groups in Henry Hill, right away we realized that 6 feet is not always an option. So, how do we make sure we can put our staff and our students in those best positions when we don't have that? So things like if I am a teacher or a administrative or an instructional assistant that has to touch a computer of a student, am I washing my hands or hand sanitizing right after that? Continuing to wear the face masks, et cetera. And even in those conversations about PPE as we move forward. So again, that's just a starting point as we go through the presentation tonight, and you're going to see that grounded a couple times throughout the slides. So I'm gonna pause here because again, I'm gonna open it up to Jackie and Christy here a little bit to just, from their perspective as the leads of the Polk County, I think one of the things in the guidance are these key practices to prevent the spread of COVID-19, and just to share a little bit their perspective as we think about coming in the schools and the things that are in our blueprints. What you would like to share just in how important these processes are for us as we move forward.
Sure, and I'll start. And I would say these are the keys to your success right here, is not only developing your guidance, which you guys have done a great job doing, but implementing it on every single level, every time, consistently. This is what's going to keep transmission down if there is a case of COVID in your schools. So I don't think we can emphasize this enough, that these are the building blocks for the success of your schools and reintroducing students back into the classroom safely.
And I will just, sorry, I would just add that we have seen this time and time again when we have been in communication about certain cases or reported cases where we've seen how these measures really have helped to control that or keep the spread maintained. So I just want to emphasize that we have seen that in practice as we collaborate with Jason and the whole central team in addressing reports of cases.
Thank you. The other piece of this, we have an operational blueprint that is approved by Polk County. And again, if we make changes in that, that is communicated with them. We have a letter from them on file saying our protocols are solid. And then obviously in conversation with them as metrics and certain things move in directions in a positive way, that, we would be able to open that. So they truly are or have approved our plan. And we did that really early in August and continue to refine and update them on just shifts and things that we're doing within the school district. So again, just that reminder of we have that approval, but we continue to, anytime we add a protocol in or anything like that, that's added in, and we're just sharing that. As we change, if we get to that point to change instructional models, we would update that and again, continue to share that with them. Because again, they're part of that, I want to say their guidance. They're helping to guide. We are the ones in the school district making that decision, and the governor made that clear with her directives starting on the 23rd that it is a local decision level from that perspective in some of the changes we're going to show today. So I think there's two important factors, and again, this is on page 14 of the Ready School Safe Learners. And then I'm just going to sort of turn this over to Jackie and Christy to share a little bit more about this. Data is very important to me as a superintendent. And so that has been at the forefront since the pandemic has come forward. We're seeing what OHA and locally, and I'm going to give great credit to Christy and her communication with me weekly in the data that I request. And she is very forthright in sharing specifically with not only our zip codes, but the zip codes around us. That case counts are part of that. So I'm just gonna, Jackie and Christy, let you talk a little bit about the importance of this and why it is an important factor.
Sure, and I'll go first. Our case rate tells us how much disease we have in the community. And of course, this is only disease that has been tested. So there's certainly cases out there that we don't ever know about because they never actually get a test. So the case rate is going to tell us, it gives us at least a good idea of how much disease spread there is. And obviously the lower the case rate, the lower the risk of transmission in schools. And essentially it comes down to what the community is willing to do to help the schools return students in classrooms. So it's about doing all of the safety measures that not only are you guys doing in schools, but we need to be practicing as a community because that's what's going to help us get where we want to be. So that means social distancing, at least 6 feet, not getting together with your friends and big groups of people, multiple different people, keeping those get-togethers small or just non-existent, washing your hands, staying home when you're sick. All of those factors are what the community can do to get us to the point where the risk is reduced for kids coming back into the classroom. So I just really want to emphasize that because it's on everybody's shoulders to do what needs to be done. And we can say based on just looking at our cases when we do our interviews, a lot of our transmission in Polk County is coming from small group get-togethers. We do have outbreaks at different businesses. And again, a lot of times they're doing everything right within the business. It's getting together outside of the business that's actually, triggering the outbreak. So we just can't emphasize enough that it really is going to take the community to continue to do what they're doing in order to mitigate the risk and lower our case rate.
And I'll just kind of to piggyback on that, As Jackie mentioned, it's not only a factor that affects schools. I mean, I think case rates are looked at for a various variety of different things, metrics in reopening certain businesses and restaurants across our county. And so we know that that's all interrelated. We know that, that families don't necessarily, we can't keep everyone sort of contained, right? And so I think just considering that when we do our part, we're helping every corner or and every space within the county. That's all I had to add.
Thank you for that. And then again, the second part of that, two important factors, and again, I think Jackie, both of them have hit on this, and I think Will, is that, how our ability to implement our protocols with fidelity. I can say that we have been up and running, staff in buildings, all the buildings. We have had cases of, we are required to, as staff, and again, as we receive information potentially about students, the principals and our administrators and our managers have done a really good job of getting to Jason and then Jason reporting. And again, we do have larger positive cases of staff than some of the school districts around us. And again, that's just part of, we are tracking, and that's part of that process. But in those, we really have only had 3 cases that are tied to the school. So to the schools, and that is part of that process. So I feel really confident in what we have done with our protocols in the buildings as we continue to move forward. So again, our staff, I'm appreciative of them. They're very honest with us and continue to do that. And that's what we are thankful for, because they are part of this, equation, right? Our staff and our students and our administrators is really what makes up the school district. And collectively, we need to make sure everyone is safe and healthy as we return back into the building. And that's my responsibility as the superintendent. I am responsible for all students and staff. And so I have to take all of that into consideration. And these public safety protocols are part of that piece. Anything, Jackie or Christy, to add to this part?
I will just add, and this kind of ties back to the previous slide, but one thing that I want to really emphasize is that we've been seeing a decrease in positive cases reporting information of their contacts or people who they've exposed potentially. And that's one key important thing that we use, a tool that we use in order to contain the spread or potentially prevent more spread. And so I just want to point that out as important as a safety protocol and helping the case rates. That your staff had done a phenomenal job of being completely honest with us as well. I think that we want to drive that message to the larger community and to students and parents that when we provide a call, when we give a call to a potential somebody who's been potentially exposed, it's not by any means that we're that anybody's in trouble. We're just really trying to make sure that everybody has the resources that they need to stay in quarantine or isolation if that's the case, and that we're able to provide the education and any resources that may be needed. So just wanted to reemphasize that piece.
And if I can just add one thing to that, and hopefully people are aware of that, but if you're a close contact to a positive case and the county reaches out to you, we don't divulge the information on who the positive case is, because we know that there could be a sense of guilt or shame or whatever that the positive case is having. And that's all HIPAA protected information. So if we're calling your close contacts and you're the positive case, we just want people to know that your information is never released. It's just a very generic, hey, we wanted to let you know that somebody identified you as a close contact and they've been diagnosed with COVID-19. We want to make sure you have everything that you need to quarantine at home so that we don't continue to spread this disease into the community. So that's just something for, I think, the larger community to be aware of if they're not already.
It raises one question that Darcy and I were actually exchanging, and that is, and there's been some community talk about this, not just, who tested positive, but who's been vaccinated. Am I correct to assume that is all HIPAA protected, private information, that would not be released?
Yeah, we would not release that at the county to anybody.
The school district, same thing, right? I mean, we would
Yeah,
not.
we would collect information. We are, again, same thing. We are not allowed to share any of that information.
Yeah.
Right. So we could, the communication channels between the schools and ourselves is fine, but that's not any information that would ever be released out to the public, if that's your question.
Yeah,
Can I add to that? Possibly. With that question, I understand that it's a HIPAA, like it's a no-no. But with regards to that, I've had a few questions of people, for example, a staff person who chooses to not vaccinate themselves for whatever reason. How does it work if a parent wants to know that information about the teacher? And for example, they won't ever, it's private, but if the parent is asking that, can they ask to move their child to a different room? If we, do you understand what I'm saying? It just,
so first off,
Darcy.
First off, that's personnel information, and we don't, as I've shared many times, we don't share that. So that would not even be a conversation. Our principals don't see any of that information. Just to give an example, there are really 2 of us that have that information in the school district. But again, that is not anything that would be shared out at all. That is a choice by employees. Again, we are collecting some information, but again, that is for really 2 people only in the school district. And that is not for any, again, that's personnel information and would not be shared out to anyone. Good question, Darcy.
Thank you.
So I want to take a little bit of time here. There is new regulation, and you'll see it here, that when we begin to operate on site, and I did have to send some information today to the Oregon Department of Ed to get clarity on limited in person, but I believe even though that may be a partial on site, that it's still considered on site, and so I believe it will fall into the testing window. So again, I'm getting clarity on that because it wasn't clear in the guidance, but we will, as we move into on-site, that we will no later than March 1 be required to, or the school will and must offer access to what is called on-site testing for symptomatic students and staff that are identified on campus. And then again, potentially those that may be in a cohort. For example, if it is a student, or if we do have a staff member where they may have been, again, socially distanced in a room in a professional learning community where, they were over 15 minutes together, as an example, that we would have to, that test would be there. So I'm going to let Jackie sort of explain what the test is, the positives and the negatives of that. And then I can sort of, what she doesn't cover, I can sort of share what the process, and I would say this, I want to be clear, this is new guidance. So I have had 2 days to digest this. I've read it 3 times. I know Cease has read it a couple times. So we are still working through some of those. Angela Billman, who's with us tonight, who's one of our nurses, she's part of our outbreak team. We're having conversations about it. So I'm going to turn it over to Jackie and Christy to share a little bit, and then I can answer any questions about what we believe the process will look like as we build this.
Okay, thank you. And I read the guidance over today as well. So I definitely have the basics, but I am familiar with Bionex now, and that's the antigen test that will be supplied from OHA to the school districts. And essentially it's a test, a rapid test that takes 15 minutes to do. The way that ODE has outlined how it will happen is that it will be a self-swab. So the student needs to be old enough and have enough dexterity in order to swab their own nose. It's not a nasopharyngeal swab, meaning it doesn't go back to the back of the throat through the nose. It's just basically, you know, about where you can stick your finger in there is how far the nasal swab goes. And then it would be the responsibility of whoever your testing assistant is to actually process the test. And that's just a matter of adding the reagent to it. Actually comes, it looks like a little credit card. I'm sorry, I don't have one with me. And you put the reagent in and then you put the swab in, and 15 minutes later you have your test result. So on the one hand, it's not the most challenging test to do. I think the challenge is going to be having a student have the dexterity to be able to swab their own nose. The guidance is pretty clear that if they're unable to do it because of age, because of disability, then it wouldn't be done. Either way, you know, if a child is, or an adult is symptomatic, they're getting their test on their way out the door. You know, this isn't, if it's negative, then you get to go back to the classroom, regardless of the outcome, whether they have COVID or they don't have COVID, they have something, and something that you don't want to, you know, give to other classroom students or to other teachers. So that's a little bit about the test itself. It works the best on people who are actively symptomatic. It's not quite as accurate on people who are asymptomatic. It's not as high a reliability. However, it's also better than nothing. But just like any test for COVID that we have right now, it's a snapshot of whether you have it today. So a negative test today doesn't mean you won't develop symptoms and test positive in 2 days or 4 days or 6 days, et cetera. So I think that's really important to make sure that we're aware of. That is just giving you a snapshot of whether you have enough viral load in your nasal passages to test positive. With this test, there is a chance. Yep.
Is it available now? I mean, I'm wondering why it was set March 1st. I mean, is this a readily available test that we could get our hands on next week and train somebody and be ready to go? I'm just trying to get a sense of what that hurdle looks like.
Yeah, and I don't know if there are any hurdles, because the test actually comes from the state. It doesn't really run through public health, but I know the state has some.
Let me add to that, because I have enough information. What I will probably be doing tomorrow is I will fill out, there is a registration form that the school district must complete. And again, I may need the help of, I haven't looked at it completely yet. I did a quick glance of it, but I will work through and fill out that document with my key staff that I need to be able to do that. Once I do that, an email goes to OHA saying that we are requesting the testing. We will need to identify, and I'm going to say we have some great partners in town that have built testing already, and I have been reaching out to them to, again, you all know that why reinvent the wheel if we have people around us that are already doing this and have been doing this type of test. So trying to reach out, but we will have to have both at every school, a school testing administrator, which again could be the principal, but again, I'm hesitant of that just for many reasons, because if it's them and they're around kids that are positive, then they're going to be out of the building. It does not have to be a medical person, so I don't have to have nurses, although we, in our conversation a little bit with Angela, who is one of our nurses for the district, we were talking through what that might look like. And then we have what's called a testing reporter, so the person that's going to be using or putting the data in, because there is a data system that we will have to report to. We have to dispose of this. So there's a process of getting materials because again, I call them the little, you all see them at the doctor's offices, I believe it's the little red box, correct me if I'm wrong, Jackie, right? We'll have to have red boxes to put those materials in because they are hazardous or potential hazardous.
Yeah, you'll need a biohazard bags, and then you'll need some way to get rid of the biohazard bags so that they don't go out in the regular trash.
So we don't know for sure how long it's going to take to stand this up, but all the rules, the application process, we don't foresee this as a major hurdle, relatively simple to administer. So not a big barrier, but just something we have to have in our plan to have ready to go. Because maybe we're below the metric, but at this point in time, probably not. So we have to do this, right?
Correct. And absolutely. And again, not required till March 1st, although I believe that if we're doing that, I do think we need to talk through staffing. And because this is just, it's only been 2 days. We had some meetings with our administration today. We have long meetings next week and continue to have those meetings. So we'll do that. I would think the other piece of, because just Jackie brought it up, I'm not sure about the disposal, so I didn't get far enough today, but we'll continue down that road. But I think the other piece that's really important, that we have to have consent, and that we have to have consent from families. And that consent cannot, normally we do a passive consent that says, hey, you're allowing us to move forward with this unless you sign off on this document. That is not the case. This is a very transparent, and again, that information is in the appendix of the guidance that was released on Tuesday. So we will continue to work through that and start to get those out to families as we look at and identify students coming into the building. So I want to be clear about that process is going to be really important as we move forward in the testing.
Do we know what that looks like if someone doesn't consent?
Then we don't test and they still go home. So
And then I don't, go ahead.
I think as you will hear, Jackie and myself and Christy and most of our principals, and even as our union leadership is on here, we have been very clear. If you are sick, please do not come into buildings. I've had to do that. I think we are very clear, and we will continue to be clear about that. That in itself brings other staffing issues, but we're working through things. We've got good partners that I'm in conversations with. We have really smart leaders, not only administration in the union, of different ideas that how that might work. So we have staffing. And so I think that's a big part of some of that as we go into having kids back in, because I want to be clear, we do not want kids coming to school that are sick. And we're going to talk about the entry process, because that was a real important part of the presentation to us as superintendents on Tuesday from the Oregon Department of Education. So Darcy, if people say no, and for example, someone is sick, then, and we don't have that on file, then we will call a parent or guardian, and then they will be sent home. And then advised to, depending on what the symptoms are, to call their health provider to see if they do need to go get a COVID test.
One of the things we learned last night in the call that Jan and I were on was that OSBA was working on a draft parent consent letter. And I don't know if that would include consent to do the testing, but it would make sense. Jim said that the letter might be available today, but once it is, we could look at that and see if it includes language around this. So it would make sense to just have one consent letter as a part of our plan.
Yep. Yes.
Can I ask a question?
Please.
Absolutely.
Yes, Jen.
Yeah.
Okay, so I'm just speaking now as a former principal. Lots of times it's very difficult to get hold of parents during the day. And sometimes it's outright impossible to get hold of anybody. In those situations, if we have a child who is pretty symptomatic, will we have, you think, in our plan some way to isolate that student? I know we all have sick rooms, but when you have a really sick child, there's a whole set of sanitation protocols for the people who care for the child. And like, you can't put a first grader in a sick room and just leave the kid alone. So I just want to make sure that we will have, I know this is impossible. I mean, I can very well envision a parent saying, no, the kid can't come home. Yeah. If we could even get a hold of the parent.
And I think that's going to, and I appreciate that, Jan, and I know that, and I would welcome principals to, just as because again, we have built some of these and they are looking at those in their buildings of what that would look like. I mean, because we have to be prepared that we might have 6 at one time, again, as an example.
Exactly. Yes.
I think, Jan, one of the things that we will be very clear with the community is, and I know that this will be hard, especially as we bring students back in, is if they are any sick, sniffle, cough, they will not be allowed to come to school. And that process of entry, which was very clearly articulated to us, and we're going to talk about here in a little bit, we are going to have to figure out that, because that will be, and Jackie and Christy, correct me if I'm wrong, if we have that and they're coming and it is a COVID issue, that will be what causes our buildings and cohorts to potentially come down. So I'm going to open up elementary, either Kim or Nicole or Ashley, if you want to just share what you guys have been talking through, and even Jason, as we did, just to give a couple examples.
I can share. So currently we have a location. It's an isolation room, but within that, we actually purchased, and I'm sure you've heard about this when we started our limited in person back before winter break. We purchased what are called pods. So they're individualized pods. So technically we could have more than one kid in a isolation space, and they would be isolated within those pods, and they're clear. They look like those kind of a mini tent. And you can wipe them down so we can clean in between students. And then we have multiple pods for those students to wait, because normally kids wait in the front office, and that can't happen anymore. So that's what our plan is at this point.
Will every school be provided those pods?
Yeah, we will continue to work through that. Again, obviously with elementaries had been the starting point, but as we work through with our secondaries, that will be part of that conversation. I think high school a little bit different, right? Because some students may be able to transport home, again, depending on how they are, but that is a huge part of our continued planning that we have within the district, because that isolation and quarantining is a big part of that process if we do have an outbreak or a concern of sickness at the school.
Can I ask another question, please? Okay, I'm concerned about the staff that would be taking care of these sick children. Again, high school kids, for the most part, need someone to look in on them every 15 minutes. A 6, 7, 8-year-old child who's really, really sick is going to need at least emotional caregiving, if not physical caregiving. And which of our employees is going to be working in that kind of a risky environment?
So Jan, those are the continued conversations that we're having, both with our principals and, again, the union leadership that is part of this meeting tonight. I think staffing issues are, as I've shared, I think we're still going to have to work through some of those. I know that I've shared with you all that we are going to be getting some more funding from the federal government that should be coming here. It's a much more robust funding to help with reopening of schools. So we know we may have to look at additional staffing, whether that be with partners in the community. From that, I think those pieces like having that staff be in full PPE, because that is additional protections as an example. So those are, Jan, you bring up a great point in the continued conversations that we do with our union leaders in Meet and Confer, and how we're going to work through that, what that looks like within those environments. And then do we have partners that potentially could be part of that? And what would that look like as we move forward? So all of those pieces we continue to build and look at as we move forward, because again, I think that's a valid point. We don't have that type of person, Jan, and most school districts do not. But again, that is part of within the guidance, the PPE and how we, one of our protocols is how to put on and take off and clean PPE. Because again, that will be part of the process that, as we shared with our, because we have started training with some of our K-5, well, we have with all 3 K-5 buildings, with reminders of the current protocols, but starting to train them on other protocols. And one of the protocols we will continue training on is taking on and off and cleaning PPE, because that is part of our world as we go back into the buildings. And I want to be clear about that. That is a huge part of the work that we continue. And that's why we are continued conversations with union leadership, making sure we have full understanding. My job, again, and I'm going to say this, is the protection and safety of both our students and staff. That is my #1 priority, even above academics. And you as a board, I've been very clear with you on that as the superintendent. So Jan, those are the continued pieces we are building and working together on who's the best, what would that look like, those types of pieces as we move forward. Because we can't do every what if. We're trying to build for the best scenarios that we know, because we know there's tons of what ifs as we come back into the buildings.
Okay, thank you. I just hope that members of the public who are clamoring for schools to open tomorrow maybe are listening to this and can hear all of these things that have to be in place. You just can't snap your fingers and open school as much as we all want to.
Okay, I'm gonna, one of the next pieces of that I want to just share as a reminder, and then we're going to go into some data, is we do have to keep, regardless for emergency types of situations, that we are, and again, this was made very clear, that if we aren't meeting metrics, which is what we are in right now, that we as school districts must provide a comprehensive distance learning instructional model. So that will not go away even as we move into in-person, of limited in-person, and as we move forward, that is again the framework, and that is why right now, because we aren't meeting the metrics, we are in that comprehensive distance learning environment at all of our buildings. And again, this is just a reminder. Again, I'm going to go into the advisory health metrics, and then we're going to get into our local data. But it's clear again in the update as they talk about the advisory metrics that, again, that case count rate, when we're deciding those or working with Polk County, and again, them giving me guidance, and then myself, and then obviously this team making those decisions. And then how are we actively ensuring that we don't introduce new cases into the schools, which again, I think Jackie and Christy have shared clearly is one of the things they want to be aware of. So this is the new metrics. And again, not changing from when I look at the left side, the white bars going down in the columns, the metrics in the model. So we are still looking at county case rates per 100,000 over 14 days. So that 2-week, you hear me say 2-week look back. We also look at county test positivity, and then the bottom row is really the advisory instructional model of if we're hitting these numbers, this is where we can go. I think, so again, you can see that in the red used to be greater than 200. Now it's at greater than, or excuse me, less than 350. To be clear, right now we are 460 in Polk County. So we are at 460 in Polk County, and our county test positivity is 10%. You will see the boxes below that in the red, which is where we are, it shows prioritizing that comprehensive distance learning that we have been in with limited in-person instruction, which is part of the focus that we'll talk through at the end of our meeting tonight. I think one of the big changes, and then again, going really, we're in the far right, our goal is to move to green. So as we move into orange between 200 and 350, then we would move more towards some consistent on-site type of for our elementary schools, because again, the focus from the governor has been very clear, really focusing on those K-5. And then if we can move to the yellow, again, that continued on-site and or hybrid, if we get there, that 50 to 200, which again, starting to look at our younger ones, but really then looking at, can we start to bring in middle school, and again, with allowable limited in-person instruction. But again, there's still a lot of moving parts with that limited in-person instruction as we look through all these. I think the one change that is different for this metric versus the previous one, again, we had limited in-person going. We had started it at the elementaries for our targeted students. And we were last, when we had an outbreak, it was clear that we needed to bring things down. Where the difference is now is if we have, for example, an outbreak in a cohort, let's say I'm going to use Ashley's building. So Ashley's got 3 cohorts of 10 students going. And one of those cohorts gets or has potential exposure to the virus. That is an outbreak potentially that would be in her building, but we don't have to take the entire building down. Now we can't add any more, especially if our metrics are still high. But if we have an outbreak or our metrics start to increase again, so again, I'm going to talk a lot about metrics increasing or decreasing, whether we have an outbreak or if the metrics were to increase. Ashley at Ash Creek would be able to keep those open, but she would not, it's not advised, and we really cannot add any more groups until that starts to go in that downward trend. So again, that's a little bit of a different change. That was not the way the previous guidance was. And that's articulated in the white box below in orange and red. So this is where we sort of start. So now I'm going to share a little bit of where we are in for us as Monmouth and Independence. And this is really data that we pull from the Oregon Health Authority specific to zip codes and population, because I think it's important. And again, you can see obviously on the left, the towns, the population, the total cases that have been identified in their state, and then based off of that, the total case rate thus far for each of those towns. But I think it's really important, the last 2 columns, the difference in population. So going from the top of Dallas, so Independence and Monmouth is 8% higher in population than Dallas. Then going from Independence to Monmouth, West Salem is 32% higher than Independence and Monmouth. Does that make sense? So I just want to make sure that I'm working down. So when you go to the right of differences in case rates, we are 44% higher than Dallas. And West Salem is only 3% higher than what we are, but their population is 32% higher than what we are. I'm going to say that again. The case rate difference from Dallas, we are 44% higher than Dallas. Then West Salem is 3% higher than Independence and Monmouth combined. Yet West Salem's population is 32% higher than our population. So when I talk about just having concerns, that is one of the key pieces we look at.
Do we have a theory or an understanding of why this is the case? Have we had in Independence, Monmouth, specific outbreaks within businesses or something that, because one of the voices in the community that's pretty loud and clear is the belief is that we're looking at Polk County data and West Salem is skewing our data. And in the beginning, I think there were initial outbreaks in West Salem convalescent, and that's kind of, I think, stuck in people's minds. So I'm asking this question to make sure we understand is this an anomaly around a couple of cases, or is this just widespread? We're just higher for some reason than the other areas of the county?
That's been a common question I've been getting. And a number of people are blaming the adult care homes in the area, nursing homes, convalescent homes, et cetera, as that's where all the infections are. Therefore, kids should be able to go to school. So perhaps the public health people could give us some guidance on where are these infections. And thank you for asking that, Steve.
This is Christy. I'll take my first stab at it. Really, that's the golden question. I think for everything. I think if we knew the source of it, then we would be able to put in the resources to contain it. The way that this virus works is that we really don't know. It's really widespread at this time, and it's across the board. I think one of the things that I like to point out, and Jackie has pointed out before, is that this is a representation of people that have been tested. Also a representation of also that we have to take into account that there's many folks within our community that are not able to work from home. They're essential workers that have to keep on going regardless of you know, whatever is happening. And so I think that is to be taken into account, not to and really to not put a blame on one specific source, because we don't have the answer as to what the specific source is. It's just really widespread. I think we're going to sound like a broken record, but really going back to the safety protocols and following guidance, masks, social distancing, and all that is what's really going to help us in preventing further spread. In terms of outbreaks, we do have data on outbreaks. And yes, in terms of what documented outbreaks, long-term care facilities in general across Polk County are the highest in terms of outbreaks, but it doesn't, still, when we look at these numbers, it's not a good apples to apples comparison. It's really, you can see that it's just really across the board spread in the community.
Thank you.
The only thing I would add to that is we can say there are no long-term care facility outbreaks in Independence and Monmouth at this time. So there we have 3 facilities that have reported out, and they are in Dallas and West Salem.
Have you seen a trend where the disease is spreading from North Marion to Salem to now Polk County? And one of the explanations might be, I mean, it started in West Salem, it came this direction, and then Dallas is a little bit more remote. Perrydale is even more remote. I mean, if you look back over time, almost by zip code, would that be the situation maybe?
When we look back at the trends from when the virus first started, West Salem was really aligned with Marion County in general in terms of the rates. And when we look at the rest of Polk County, really Independence was second next to West Salem for a really long time. It's just recently that kind of Dallas has trended up, and we're seeing kind of a balance, but then we still, yeah, there's not a sequential order of it coming from North Salem and on. It's kind of been first West Salem and then Independence pretty high up there, and then subsequential, and it's kind of variated across the time.
Do you think that we have a lot of our population, you mentioned essential workers or people that are still working, are they traveling potentially into Salem where there's widespread virus, and then that's kind of how Salem goes, we will go in Polk County?
Potentially. I mean, really our community is fluid, right? And when we look at Salem and Marion and Polk together as a whole region, we're the reddest spots for case rates. And so potentially, but we also have many workers going into Polk, going into Yamhill, going just across the region in general, where there's less rates. So it's really a hard determination to tell you that that's it, but it's certainly a factor that we consider in the case rates.
Thanks.
And I flipped to a different slide here, and I'll go backwards, go forward. But Christy I thank you every week for sharing this with me. Not only do we look at the overall, but I've started to ask for, I just want the case rates for the week to give you an idea as they talk about the influx and up and down. So again, we're the top line. And again, you're looking at the week from 12/27 and then the latest one through last week. So you can see just for our 2 zip codes, we were 35, then 89, And this past week, we were 54. If you look at Salem, again, they were 95, 70, and then 59. And then as Christy said, you're seeing that Dallas uptick a little bit here this past week. So this is another data point that I continue to request and look at as we look at making decisions. And again, we've started to share this with the community committee as well to just keep them informed, because there, again, we have our staff, our union leadership, our administration, and families on that committee that are helping to really drive and what we need to move forward with and where we are. So I think this is just another different example of that, that up and down that I think Christy and Jackie have shared a little bit tonight.
One more thing that I'll,
Go ahead.
sorry, one more thing that I'll point out is that we've seen a decrease in cases in these past 2 weeks, and that the latest column there. And it's in staying optimistic, that is good, but also we have to look at the whole picture. And the one thing that we're seeing is that that's probably a representation of less people getting tested, so we're capturing less positive cases too. So just to put that caveat up there of we really have to look at trends in decrease rather than just one point in one specific time frame.
My question was just that as the governor continues to ease restrictions, it really, I don't know if it's accurate to say, does it really just come down to our metrics for getting kids back in the buildings?
For this, I'm going to go backwards. For this in a longer period of time, yes, Darcy, that is, again, although these are advisory metrics, and again, we're going to talk a little bit about liability because there was, again, these were mandatory. They changed into advisory. We do have some legislation tied to insurance, which again, from my perspective, then obviously you as board members, we are responsible for the school district from that end. This was a very key point of be careful not following this, because your risk and liability, really, you're not covered. So should we have anything catastrophic, we would be accountable for that. So again, I don't like saying that, but I do, this is a big part, Darcy, yes, of our conversation as we continue forward in decision making. Not the only one, because we, again, we have great protocols, our required protocols in sections 1 through 3, which I'll talk through a little bit here in the next section. But that is also part of it, because that required, we have to be with fidelity in there. But then again, this is part of that decision making, and really myself, Jason, our outbreak team conversations that we have with our Polk County partners.
Thank you.
And then I'm going to say, because I'm going to pivot to this point, because I think what Christy said just right now is, I think, a very valid point. So this is our 2-week look back. And we've built this into, every 2 weeks, red is not good. We're trying to get to green. I want to point out that in 12/13 to 12/26, we were almost to the 350. And then we knew we had winter break, and we know that there are holidays in there. I think the one thing, and I'm going to say, well, with what Christy said, at least this past week, we're down, right? So we're decreasing. So we went from 481.1 from 12/27 to 109. But then the next look is 460.6. Again, it's not a ton of decrease, but it is a decrease. And so that in our conversations, as I continue to talk with them, they want to see that decrease going down in that direction. And then obviously you see where we were moving down in testing, and now we're just sort of steady 10%. So that is also part of the, when I'm having conversations and looking at different things with our leadership team, these are the key pieces that we're looking at. What does this 2-week look like? What does the overall picture in our county, in our town compared to others look like? And then I'm going to go forward. And then again, the last couple of weeks, I've asked Christy more for I just want to start looking at the weekly trend to see if there, I mean, right now it's up and down. So it is data, but it is part of that, just looking at what we're working through from that perspective. So I'm going to pause before we go into vaccine. With any of the data, or Christy, Jackie, anything to add to the data part of this?
I don't think
Can
so.
you
I think I've mentioned
guess-
everything.
Can you give us your best guess as to what the next 3 months look like?
I'm gonna let you two answer that.
What I would love to see happen is that the numbers go down because people continue to do what they're supposed to do. So this is a community effort. So it's really hard to predict what people's behaviors are going to be. But if it's up to us, then people are going to wear their masks. They're going to socially distance. They're not going to get together with their friends and extended family. They're going to protect themselves, because protecting themselves is protecting their community. Protecting their community gets kids back in school. So I'd love to say, here's what I think it's going to look like in 3 months. I think there's too many variables over the past few months with holidays and so forth to really accurately predict, but I can just tell you what we'd really like to see.
So for our planning purposes, we could assume that it's going to probably stay in this range. It's not likely to start dropping dramatically down to 350, 300, 250, 200. For the rest of the school year, we're going to be either yellow or red. And you don't have to answer that question. I say that because I'm pretty convinced the challenge before us is that with this background level of widespread COVID now in the community, even with all the practices that Jackie was just mentioning, we still are going to have to make a decision. How do we restart schools? And there's no magical answer. I mean, we're going to have to learn how to do this really, really carefully and smartly and monitor this as we go. But what I think the governor has done in changing the guidelines to making them advisory is giving us the choice to proceed when we think we're ready to go. So you have to start thinking this rate of cases in our county and our community is probably going to be at this level. It might start to decline, but you know, we're going to be faced with this disease in our communities as we're restarting schools somehow. Jerry? No, we can't hear you, Jerry. So do you want to use the chat on your computer, Jerry? I think you can just type in your question.
And then Emily, if the question jumps in there, please stop me, because I'm gonna move forward with, unless anybody has any other questions specific to the data, and talk a little bit about the vaccine and where we are. So when the governor on December 23rd shared her letter to the Oregon Department of Education and the Oregon Health Authority, I very quickly that day, and really on Christmas Eve, spent a fair amount of time with some leadership in the state, starting to make sure that we needed to get things in order. That by that next Wednesday, we had started, and I believe it was December 30th, Jackie, I think it was December 30th, we had developed what we're calling just sort of a Polk County collaborative. And in that Polk County collaborative is of all the superintendents of Polk County. Jackie and Christy are Polk County health partners. Additional administrators in the school district, so it is superintendents, but at times it's other leaders. West Valley Hospital, because they're part of the process with the vaccine, and really the implementers of how we're doing this, as well as other Polk County partners. So we brought in our community and family outreach, Dana Goodall, who is really the lead for us on our mental health associates and professionals in the buildings, and then our behavioral health director, Carrie Blum, who talked with our community last week, because we know as we go through this, and you'll hear, and I'm going to give great kudos to our administrators and our teachers and our support staff of the social emotional and the focus that we are doing. We know that that is really important. You all know that that's my background as well, and how we do this. Academics is very important, but right now we know as much as social emotional piece, so we wanted to make sure they're in that. So we meet weekly for an hour and a half and have been talking through not only the testing a little bit and actually getting questions early on, but really starting to drive the vaccine. And so there was, you have all seen, and I have shared in the last week or about a week and a half, we've had a lot of were we in 1A? We were in 1A, and then educators were out of 1A, and there was clarity. I do have the opportunity to sit in on Tuesdays. I do meet with the governor's office with a small group of superintendents in helping to, from at least the K-12 level, what does that look like and how do we move forward in a way, because we know as the governor shared, I believe it was last Friday, this is going to be a slow rollout. It is very clear our frontline workers, our nurses, our doctors, the ones that are really working with patients that are in hospitals, et cetera, care centers, that has been the priority, and that should be the priority. And so Polk County has done an amazing job. Christy shared, we're the third best county in vaccines in the state. That's how good we are. That's how good they are in both Polk County Health as well as our hospital. So I give them great credit to that for putting us in a space that we're at. I will also say Polk County with our collaborative is a leader in the state in helping to say, well, what have you guys done? How have you done this? I give great credit to Christy. Christy sent out a survey to all of us superintendents. We built a survey within school districts. We worked with our union leaders. Please have staff fill this out so we can start getting numbers. Again, confidential information, not to be shared, but to really give Christy and the hospital, or Polk County Health, Christy, Jackie, the hospital's numbers, so we can really start to say, how many do we need to get our K-12 educators going and moving forward? The vaccine process has changed. We know that the metro area in Portland, that area is far behind in some of the things. So there's been conversations about making sure that our phase 1A groups are done first. And we know that that type of impact is going to hit those of us that have been successful at that. So our number of vaccines that are both our health department as well as our hospitals receive or have received in the past has gone down. We are not getting the same amounts as before. And again, there are some equity issues across the state specific to the phase 1A. Those are our frontline workers. And we have got to across this state, first and foremost, get them vaccinations. But the governor is very clear about us as a K-12. Over the weekend, Jackie and I were in conversation through Saturday and Sunday, and it was clear that in group four in phase 1A are any of our staff who work with students experiencing disabilities fell into that area, and then anyone who's working with that. So our transportation services, our nutrition services, our special education, both teachers and support staff started the process of vaccinations because they fall into that group. So they have started that process. We are now working with Polk County and the hospital to start Group B. They are almost done with Group A, and Jackie, correct me if I'm wrong, we're almost done with Group A, but we can begin to move forward with Group B should we get the vaccines. And I think that's the big conversation right now. So Jackie, do you want to share anything based off of just that process or how it looks from your end?
Sure. And when we're talking about Group B, we're actually really just talking about educators, childcare facility workers, and early learning. We're not moving any further into Group 1B. That's being determined by the Vaccine Advisory Committee, kind of where we're going to go from there. So what the governor said the latest from last Friday, and hopefully it doesn't change again tomorrow because I'm just getting used to last Friday's news, was that we could start vaccinating on the 25th of January, the people that fell into educators, and then child care, and then also early learning. And right now our biggest struggle is getting vaccine. And it's the same across the state. We're not unique in that. And I do think that they are trying to balance the bigger communities who are just still working through their phase 1A compared to us. It unfortunately does feel like we're being, punished a little bit for doing such a good job, because we really, our goal is to get shots in arms. Our goal is to get everybody in Polk County who wants a vaccine who's eligible for it. So it is really challenging to be kind of throttled down by the state and in terms of here's how many you get, and you need to make it work, which we are, and we have great partnership with West Valley Hospital, who's really just taken the lead with vaccination in our county. And we're really lucky to have them on board. So we are still working through phase 1A. Tomorrow there will be a clinic. They are operating their clinic out of Western Oregon University. West Valley Hospital is, and that's where it will probably stay from now on. And then we're planning for next week. We do have some vaccine, and we're potentially getting a transfer, but that hasn't been set in stone yet. So we will continue to work on our planning, but our goal is to at least begin the process of vaccinating educators, early childhood, childcare workers next week.
And then I will add to that part. Thank you, Jackie. One of the things in our Polk County collaborative meeting that we do on Wednesdays, we as Polk County, and we actually brought in our charter schools this week, because again, they're part of Polk County, and we're trying to collectively do this together in an equitable way. We have given both Jackie and then Brandon, who's the one of the administrators at West Valley Hospital. We know that they're building the plan of how many do we have, because they have to make the decision how many goes to K-12, how many goes to early learning, how many goes to childcare providers. So again, we trust them and know that they're doing what's right for our community. We have also built a priority list. So in our priority list, and this is agreed upon by all the Polk County superintendents, and then those that are part of our charter schools, that we would, if we have issues of vaccine, our goal would be to go K-5 first. And if there's not enough vaccines for K-5, then we would narrow. So if Jackie turns to me tomorrow and says, Jen, pull the soups together, we think we can cover K-2, we'll quickly get together. We're trying to do messaging the same at all the school districts, because again, we're all trying to get open. And I knew that when I saw what the governor was saying, we needed to do this collectively. And I know Jackie has a small but mighty staff, and we want to make sure that we're collectively doing in partnership so we can make sure all kids in Polk County. I care about Central, let me be clear, first and foremost, but I also care about Polk County, because that's the county that that we reside in. And so, if we can get all K-5 based off what she tells me tomorrow, possibly great. If I can only do kinders, great. If we continue with, because our staff that work with students experiencing disabilities, they're part of that 1A, they can continue. And then we would just continue to build into that. Next group would be 6-12. If Jackie says I can't do all of 6-12, then it probably will be 6-8. Then moving into 9-12. And then the third group is what I'm going to say, the remaining part. So coaches, student teachers, tutors, and then obviously our district office. So we're really being intentional about those approaches as we move forward. And again, part of that guidance is because the governor was very clear, first and foremost, of getting the younger students into the building first. And so that's why some of that priority is there.
And Jen, just to follow up on that, I know that you've said this, but I think it should be in the room. When we talk about K2 or whatever, we're also talking about all the classified staff who work with those students in the buildings. and many of them have already been vaccinated, some of the bus drivers, some of those frontline folks, but it's really vital that anybody who would be in the buildings working with those students as they come in, whether, so K doesn't just mean the kindergarten teachers, it means all those staff who work with those students.
And that includes principals. So if Jackie says to me tomorrow, Jen, we have enough to do your K2, that's going to be teachers, as Ben said, administrative assistants, the front office, our principals, because they are going to be the first ones really with students in front of them, and then we'll continue to build from there.
Can I ask a question of Polk County, please?
Yep.
Do we have enough vaccine for these people to get the second dose?
Yes. So the way that it's being done is the CDC holds back the second dose. So we get the first dose allocation, and then they have the second dose earmarked, and then it is sent to us, a couple of days before it's due. That's the way it's rolling out currently. With the new federal administration, that could change. But that's how we're doing it as of now. So if we're allocated 100 first doses, we're also then going to be allocated 100 second doses. And that's the same for everybody in the state. Great question.
Thank you.
What's
I'm going
the,
to pause here. Other questions about vaccine?
what's the best case scenario to get, say, all of our K through 3 vaccinated and be able to start? I mean, is it possible that we would be able to get that done in February?
It all depends on vaccine, honestly, and it's been very unpredictable. Every week we submit plans to the state saying if we had this much vaccine, we could do this many people. We have the point of dispensing, the pod is set up at WU. We have the personnel to do it. Now we need the vaccine. And the state keeps telling us, okay, don't worry, this is going to smooth out. But right now they give us an allocation number on Thursday for the following week. So we don't have a lot of lead time for planning. Eventually though, their plan is to give us a 3-week lead time. So then I would be able to more accurately tell you, yeah, we should be done with educators by this date. But at this point, with not knowing week to week what we're getting, it's really hard to give you a great prediction. Our hope is that they allocate us enough vaccine so that we can offer it to everybody that's in this group.
However, Steve, I'm going to add this part. This group on this meeting, let me just tell you, Jackie and I talked most of Saturday into Sunday. I had quick conversations with both Julie, Cease, and Lissa. On Sunday, Lissa made calls to Ben and Christy to share with them, hey, in case you guys receive phone calls, we are starting, they are qualified in 1A, messaging is going out, because I knew both Cindy and Ben would get the conversation from other staff. Hey, Ben, why, so I'm sorry, thank you. Did I say Denise? I meant Cindy. Ben and Cindy were our contacts from Lissa, because I knew that potentially as we move forward, Ben was going to get the phone call and Cindy was going to get the phone call from other staff saying, hey, why am I not in that group? They had the information because I have been, and even at that point was texting with our administrators at the building level and saying, hey, this is, bear with me as I get information with Jackie in the hospital. We may have to flip things in a 12 to 24 hour. I hope to have more time than that, but have been really prepping this group, both at administrators and our union leadership, because they're the ones that are going to get the phone calls. And this, we know that this is a frustrating part for our staff. I give great credit to Jackie and her advocacy for Polk County, but I think this is not only an Oregon problem, this is a national program with the rollout of vaccines that we're all just feeling right now. But I feel confident in both Jackie and Brandon and them planning and then being clear to us what they can accomplish, and then us turning around, myself working within our administrative team, who then is working with our unions and our leadership in the buildings to then move that forward with our staff.
I have another question. I know I'm asking a lot, but that's my role as a board member. It's for Polk County. So do I have to go ahead to do that? Because Jennifer, you're the only one I can see right now.
Please do, Jen. Yep.
Okay. So a number of the comments I've been getting for the public suggest that there's no reason to wait for a vaccine, that other places in the country are doing this without vaccines, and why can't we? I don't really have an answer for that at all. I would like to ask Polk County, and I know I'm putting you on the spot, and I'm sorry for this really difficult question, but is there any recommendation to go ahead and open schools without vaccinating the staff members?
If you're asking me if I would recommend it, I think we need to look at risk. And the more staff you have vaccinated, the lower the risk of transmission at school, the lower the risk that they're going to bring it into the schools from their private lives. But I see vaccine as a tool in your toolbox, right? It's really what you're looking at is your mitigation measures that you're going to implement in the school. And we've talked about those already. It's following your blueprint that is going to keep COVID from transmitting among your staff and your students. So the lower the case rates, the lower the risk for having issues once you open up school. I think, from a safety standpoint, educators want to be vaccinated, and I totally understand that. But it's just one way that we're going to combat this. And, to get to herd immunity is months and months away. So I think we need to start it as soon as we can. We need to get as many people vaccinated as soon as we can, so that we can get to that point from a community-wide standpoint where we're like, okay, now we're really making a difference in our numbers. So the sooner we start it, the better. But it's really looking at the whole picture: vaccination, case rates, and how you guys are going to implement your plan in the schools.
Okay, thank you.
Can I ask a question of that same kind of in that direction?
Yes.
If when we're saying it's months and months and months away, what specifically are you talking about with regards to months and months and months away? That's the end of this school year.
Mm-hmm. I'm talking about herd immunity based on vaccination. So,
okay.
Yeah.
Okay.
Nothing else.
And Darcy, I think we're talking right now staff, right? We're talking adults. I think there's a whole other process of students as well. And that's going to be farther off.
Okay.
Does that make sense with that when we're talking about herd? I mean, and again, Jackie, correct me, because I want to make sure we share with you all. When we're talking herd, yes, staff is part of that herd, but it's the whole, not only adults, but youth. And that's still, they're still in the testing phases of younger people.
Correct.
Just to piggyback on Jan's question there, this is probably for Ben or Cindy. I think for the most part are working towards wanting to get the vaccine out to everybody before we restart school, right? That's the general, every discussion I've had with Jan, the work that she's been doing to get line of sight to the vaccines, that's all intended to try to get everything, lined up, get in line, get the vaccines, and that's a key step to getting staff back in. But if this goes on now for weeks, there really is a shortage. Have you guys done work to understand if there's enough staff or staff that are willing to come in without the vaccine? Is that something that's even been discussed?
Cindy, do you want to take that one first and then I'll follow up?
Sure. Well, we have had the opportunity for food service to get shots this week, and so has transportation. Now, of course, I don't know the ones that took the shots or the ones that did not, but we had conversations last week with Jennifer and Lisa that this possibility was coming, that we might have an opportunity to be able to get shots. And then it turned out that we did get the opportunity. So I know of several people within our central school district that went ahead and got shots if they wanted to. So, and it was a pretty simple procedure, took less than 15 minutes. And you're signed up for your next shot before you even leave the building. So I think we're going to be ready. And there is, as far as food service and the transportation, there's plenty of us that are ready to go back to work. Financially, they're hurting severely because we do not get the hours that we had before. And, you know, the potential of maybe losing some kind of benefits, it has not happened, but I'm just saying financially, we have really taken a hit besides the stress and everything that goes along with this. But as far as the chance to get vaccinations, we've gotten it. So on those two area departments.
And Steve, just to clarify before Ben, the classified staff, and particularly nutrition and then transportation, have been out there working and engaging from the beginning. So it is not we want to be vaccinated before we come back issue, I don't think, with classified. We also have had admin assistants and our instructional support staff working from the building until more recently with the freeze. So we have practice of that with our classified staff. I just wanted to make that clear. Sorry, Ben, go ahead.
No, that's fine. Yeah, and it's actually pretty similar for the certified staff. We've had teachers who are in doing theater, teachers who are coaching, teachers who are leading, weights classes. So we are not, opposed to being in the buildings, and some members are very comfortable with the safety measures being in the buildings, and the union is not trying to prevent that. I think there is a misapprehension on the part of some members of the community that the union is somehow trying to prevent anybody from coming into the building, and that is simply not the case. We have done some of that internal polling, Steve, that you talked about, just to find out from our members, and what we are seeing, and I think this is something that I've struggled with, and I've come around to the position that Jennifer and Lissa have had. So I kept saying, we need the district to be polling to find out what our staffing levels might be relative to the need. And they kept saying, we need to wait because this is a moving target. And they're right. The more I look into it, the more I'm seeing that the numbers of staff who feel comfortable coming into the building, that's changing relative to vaccination, relative to the things they are learning. And so I think that, it is proving wise that we did wait, because if we had polled people, in October, and I actually did, I polled people in August and then again in December, and those numbers are changing. So we are not, the CEA is certainly not opposed to members who feel comfortable entering into the building doing so. And I've been really heartened and appreciated the fact that Dr. Kabista has been so consistently supportive of the idea that we are going to have people come back into the building who feel comfortable, and the people who have mitigating health conditions, who are caring for, perhaps an immunocompromised family member, they're going to make accommodations. And I think that's put us in a much better place. I know you experienced this at that meeting yesterday. Our union's work with this district is so much healthier than so many of the other districts that I work with, precisely because there's not this sense that, we're going to force everybody in tomorrow, or we're not going to work with you. I think that's made our staff feel so much more comfortable. And so the people who want to come in are saying, we are ready. And there are other folks who are saying, I need to feel more comfortable. And that is that moving target that we're working with.
Great, really appreciate that answer. It's very helpful.
And Steve, just to add on to that, this is Lissa again. I think that you would find that we have high percentage, depending on the building, of licensed staff who have been actively operating from the buildings all along. So it is, I wanted to add that as well, so.
I'm just going to say, like I said, I'm blessed. We have amazing staff from top to every transportation, food services, instructional assistants, our administrative assistants, our teachers, our librarians, our admin, and just amazing group that I am honored to really serve, to be very honest. So I'm like I said, thankful to do that.
Hey,
There
hey,
was a
Jen.
survey.
Go ahead, Darcy.
There was a survey that went out. I'm not certain if it was last week with regards to the vaccine that I saw from a few staff members. And I was curious, was that to get the feeling of how they felt about some of these questions with regard to being in the buildings, having the vaccine, not having the vaccine? Or what was the purpose of that?
That was specifically to help get numbers to Polk County. So that was a vaccine to say, and again, it went out to staff. We were very clear that really there are only 2 of us that see that data in the school district. And then I was able to take that data and break it down because Polk County Health asked me for specific, like how many elementary, how many transportation, how many special ed. So in that survey, it was, I believe, and those of you that did it first, because I did it too, first name, last name. Do you fall into a high risk area? What position are you in? What building are you in? And then the last question was, would you do the vaccine or not? And that is again shared with key leadership that is responsible for those types of personnel information in the school district, which is really only 2 of us. And then we took that data and gave it generally, the numbers generally to Polk County.
But Darcy, I will tell you anecdotally, as somebody who has not seen the data, so I can't reveal anything confidential, that the calls that I got from members were very rational concerns. So people who are concerned that they may be pregnant are a little nervous. Some people who have some health concerns are pretty nervous, but by and large, people are very eager to get the vaccine and get back into the building.
Hey, Jen, do you want to do a process check, just where we're at in the agenda? And are we kind of on pace or?
Yeah, I think this was probably, I knew that this would be the part that would be probably the heaviest. The next part is just doing some updates. And then the third part's probably where our final heavy conversation will take place. So I think that I just would say, first and foremost, and then open up with any questions that you all may have for both Jackie and Christy. Thank you to both of them. I listen to other superintendents who do not have the opportunity that I have had to work with the health department. We have amazing leaders in this county. These are 2 of them right here, working through some very difficult things and helping to guide me, and then working with this group here tonight to make very difficult decisions. So I just wanted to say thank you publicly to them again.
Jennifer, this is Lissa, and I don't know if I'm correct, but I'm thinking that what Darcy was referring to was that subset survey that went out from the committee that is looking at trying to figure out what issues may come up for staff when they are back on site with respect to just some of the challenges that they are potentially anticipating so that those protocols could be problem solved ahead of time. Do you remember that survey?
I know we've done 3 surveys in the last week. Are you talking about the behavior protocols? Because we've had 2 vaccine surveys and a behavior protocols that I believe went out to our K-5.
And I think that's the survey that Darcy may be referencing, the behavioral.
Is that it, or is it specific to the vaccine, Darcy? I just want to make sure I'm answering the right question.
Darcy, you're on mute.
Still on mute. Can you come up? There you go.
Sorry, it had to do with, once they're back in schools and then some of the behaviors that, so kind of both of them. But
Yeah.
thank you, 'cause you're doing a good job answering.
Yeah, there was a survey that went out to just, again, we have protocols in place, but there are things that we are in the guidance. So, you know, what do we do with, and again, it's in the next section you're going to see, for example, face coverings. They are required, but we know at times that we may have students that potentially, if they have a student that may be experiencing a disability, that could be you know, a concern, or how we would, you know, just getting some of those ideas from our staff to continue to build good protocols, good behavioral processes. I think our leadership within the buildings, you know, continue to both in our administrators, and then the conversations our administrators are having with their buildings. To make sure that we are, you know, we are trying to, there's a lot of what ifs, and you guys have heard me say that we can't hit every what if, but I do believe we're trying to just make sure we have all the concerns of what our staff may, and then making sure that we have good protocols and training and processes as we continue to bring students back into the building. So again, that's a tool to help us just see where and what we may need to continue to focus on as we do training and professional learning with our staff. Any other questions for Polk County? Because I will let these lovely ladies go because they have long days like we do. And I am, again, very grateful to them. So Jackie and Christy, if there's anything from our team, anything else from anyone on the call?
Thank you, guys. Thank you for your partnership.
Thank you very much.
Thank you very much.
Thank you so much, Jackie, Christy. Really, really appreciate your time tonight. It was very,
course.
very helpful.
Thank
Jackie,
you.
I'll call you tomorrow, Jackie.
Well, looking forward to it. Have a good night, everyone.
Good night.
Good night.
Okay, so the next section I'm gonna, and again, I want people, I'll pause at the end here, but we do have 8 different sections that we are required to follow. So I'm gonna quickly go through the 8 sections of some highlighted areas where changes are happening. And so I'll pause at the area, and then anything that's highlighted or underlined, I'm just gonna quickly share of where we have had changes within that. So there's a couple pieces in the public health. These are all the areas we are required to follow as we move back into the buildings. And again, we have a lot of these protocols built, but there have been some shifts in some of them. One of the key changes is there's a few documents now that are required that we received on Tuesday. And to be very honest, Cease, our CFO, Lissa, who's responsible for human resources, and Jason, who's safety and risk management, we have a risk assessment that is really, we have to do. It's a document that we complete for the district, and it's now a requirement. If you'll remember from the governor, she was concerned of the misalignment between OSHA and Ready Schools Safe Learners. So this is some of that cleanup to make sure that we, in our management, we have that. There is also a process that we will put in place, and either both at a district level, or the ability that for both in the community and or staff and or students, that there's an anonymous complaint process if we are not following protocol. I want to be clear, we get lots of calls about where we might have concerns. Jason is always doing follow-up with our buildings, with different groups that are helping to lead that. So we will, that is a new requirement here. So we will be building that in the next week or so, and especially as we bring students back in. Another piece was emphasized is training. We have been doing training. We even as we came off of a winter break, have done training with our K-5 because that's been the focus. And then we'll continue to do that K-12 as we move back into the buildings moving forward. And again, those last 2 bullets, we already have a lot of that in place. The next piece, and again, you're going to hear me at the end, because our approach will be in limited instruction, limited in-person instruction that's aimed at specific needs or students. So you're going to hear me talk about targeted students to start, and then maybe getting into more grade level. But again, as we look at it, we will start in that and moving back to that limited in-person. There are some things with cohorts. You can have cohorts of 20. Again, I'm hoping we'll still see that downtrend. So we've been talking with principals of, you know, as we bring kids in, it may not be that big of a group because of where, you know, again, in conversation with Polk County, if our metrics keep going down, having that conversation of how we bring kids in. So limited in-person instruction is a small group. They can't be in more than 2 cohorts, and they can only be in the buildings for 2 hours. And again, that's going back to that advisory metric. On the right side, when we get into more of that hybrid type of approach, we flip to a bigger cohorting, which is they can be in multiple cohorts, but kids cannot be with more than 100 people in a week or 100 students. So again, we're not there. That's getting into more of the, what I'm going to say, the yellow and green areas from the advisory metrics. And again, they can be in the school for longer. So we just wanted to clarify this. This has loosened up. It was much more stringent in the last round for what this looked like from a cohorting, and the cohorting is a huge part of this process.
Hey, Jen, on the limited in person, with this revised guidelines, do we actually have a concept, a plan of how we would begin this at the K3 level? Or
yeah, the principals continue to be in that conversation. You're going to see at the end just some of the approaches that they have. Really, we built, you know, at the beginning when we had our first limited in person, but again, we had an outbreak and had to bring it down. And then the continued of how and when we expand this limited in person. I'm going to speak specifically for the grade levels, and then I'm going to say to Kim or Nicole or Ashley, if you would like to share anything. You know, they have some ideas and are ready to be able to move in that direction and continue to work with their staff. And then I know that both Mr. LaBounty, Perry at the middle school, and Donna at the high school are also having some different conversations about what their first groups may look like also to move into that limited in person as we move forward. And we're going to share a little bit of that at the end here. It'll be general, but they are walking through that. I will open that up to any of the 5 of you if you want to share anything at this point. And we can hold off.
I can share.
Perfect.
Yeah, I can just share that we do, Steve, we've been planning for this for a long time. So just because the guidance changes doesn't necessarily mean that we don't have a plan already in place. It's just more waiting for the green light to get going. So we do have, you know, kids are cohorted. We have plans in place. We're starting to work with staff. It's just a matter of figuring out when we're going to start bringing students in.
okay, that's what I figured. I knew that you guys had done this work in the fall and were asked, I think, to start getting ready again when we got back after the holidays. So I think it's just good to know that if we can figure out what the combination of kind of the conditions are to say green, let's go, let's pick a date. This is not an issue. I mean, we know what we would want to do.
And then again, I just as highlight of we will continue to train with protocols. Like I said, we've done some training with K5, because we knew that would be our first group. And so we'll continue to do that as we move forward, and they have been doing trainings. I think the other key piece is that we're working with is the entry and screening. It was very clear from the Oregon Department of Education that this is going to be a very important process of stopping and making sure that we are not transmitting and having that come into the building. So we're actually looking at a couple different tools potentially to both have staff be able to say, yep, I don't have a fever, yep, I don't have any symptoms each day. So we're tracking that. We have had a visual screen as we did things, but we are also moving to potentially ask students every day about their health. You know, have you had a fever? Have you been around anybody that is sick? The community will start to hear. And again, I know that there are certain things that we share with the community that is sort of a broken record, but we are going to be crystal clear. If your student is not feeling well, has a cough, has a cold, they should not be coming to school. We will continue to articulate that with our staff. We have videos that we have already built for our staff to remind them, if you are sick, if you have a cold, if you have any type of symptoms, you are not to be in the buildings, and continue to share that out. So that will be very clear from the school district as we go into in-person, because that's when we can have impact. So this was articulated very clearly to us as superintendents as we met with the Oregon Department of Ed, how important this process is. Again, just reminders, face coverings will be required by all. This is non-negotiable. There are pieces where obviously with students that may be experiencing a disability or may have a health impairment, we will work through with families. Obviously that is a different situation. But I want to be clear that if there are concerns of a value base that I don't believe in masks, then in the guidance, it says that we can have those students be in and stay in comprehensive distance learning. So again, this is a big part of the pieces of making sure that we can be safe in the buildings. And then we have protocols and we continue to work through isolation and quarantine. Kim gave an example. We continue. Jason Clark has done an amazing job if we have had information from staff and the isolation and those pieces. So this, again, it's just some guidance that we'll continue forward with. And I want to pause because I thought somebody had a question.
I have a question, but I'm going to put it in the chat for you to answer.
Okay, thanks, Peggy. The next section is really talking about facilities and school operations. And again, that's everything from, how we do enrollment, how attendance looks. Obviously, we all know the technology. I want to talk a little bit here about, so we have a lot of these already in place and some of them are repetitive from the first section, but there's been some small changes in transportation and cleaning. So a couple of things, transportation, we will be on buses. It will not be the same. Students will be spread out much, much more. Face coverings are required and they will be required on the bus because we want to make sure we can't have students eating, because in a smaller contained area, if their masks are down, that's when the spread of the droplets can take place. So we're working through that. We're going to be clear with families as we talk about transportation. Windows will be open. So we're going to make sure that students that are on buses are dressed warmly, because to the greatest extent possible, we are going to make sure ventilation is good. I think one of the good pieces, we believed in the previous that and everybody across the state believed this, that transportation was one of the cohorts. It was clarified on Tuesday that transportation is not part of the cohort count. So they are separate. And then when they come into the building, there are there are cohorts. Again, for limited in person, they can be in 2 cohorts. And then if we move to more in person, they could be with 100. So within a week of students. So that change, that's a big win for us, because there were some huge cohorting issues that we were trying to maneuver. It's like a puzzle, but it's like that 1,000 pieces and they're all blue as we were having to work through some of those. So this is a good step for us as a school district. And then the other one, just of a reminder that, and again, we're already doing this, but we will continue to emphasize this not only with our custodians, but we all know that everybody's going to be a part of the cleaning, disinfecting, is just touch points with that. I want to also highlight, we have, and I'm going to ask Cease to also come off and share anything, and even Brian as well. We have shared with you that we have been doing some just assessments of our buildings, and we're working through that, and we have not received the report, but that process has started. We know that from a ventilation standpoint, there's been some things that Brian Weatherly, who is our head of our maintenance, has done a really good job of looking at some other ways, because if we have concerns of ventilation in buildings, we have some short-term solves to be able to deal with any type of ventilation if we do have that issue. Again, we haven't received the report yet, but we're ready to move forward. There's one building in particular that we're really looking at and have some short-term fixes to get through this year and as we move forward with some of those pieces. So Brian or Cease, you want to add anything to that?
No, you covered it. This facilities assessment process is nearing completion. So as we had talked about, we will have the report for the board in March, but we are asking some specific questions about air circulation, airflow, and finding solutions. Again, finding out that we will have a second round of CARES Act funding. That allocation appears it will be much larger, and we don't have exact dollars yet. But the good news is that we can spend out of that allocation anything as far back as last March and as far forward as a year from September, I believe. So we will have funding to be able to make those improvements and repairs, very likely, which is great news.
Thanks, Cease. And Peggy, I'm going to go back to your question. Yes, so I will tell you, in part of the planning with the building principals, I know that they're working on protocols and how we teach expectations. One of those expectations is how to wear a mask. And so we will have signage. We continue to build that. Jason Clark has done a good job, but we know that that's going to be part of the process of teaching as we do that. And we'll have examples of that and continue to work on that because we have heard of the small. We're going to be very clear. It has to cover both the nose and the mouth as we move forward. And we will also have those on site at all the buildings as well. So hope that helps that a little bit, but that is going to be part of that expectation process.
Yeah, and we do still have a large quantity of masks that we obtain. Part of them actually, we got a donation from the Census Bureau because they were trying to get rid of a lot, but we also have some masks, specifically child-size masks. That was something ODE procured. So we do have plenty of that equipment. And Peggy, the new guidance is very specific about face shields even, and how face shields are not allowed. So we will be following that guidance. And
I have a question.
We have videos even, so.
Can I ask a question?
Yeah.
This is more of a legal question. So concerning the Office of Civil Rights, what latitudes do schools have in requiring masks? Because there are some people saying that wearing a mask is a violation of their civil rights and would file an OCR lawsuit. So what security do we have legally in requiring these certain types of face coverings?
And Jan, I think that's why, and I moved back a few slides. There is clear language in the guidance now about this. I think this is our guidance and requirements that we as school districts are required to do. And this was an emphasis. So I think because of that conversation, this was part of that, making it clear, because we know that this is a public health concern, that in the public school setting that this is, and that again, there is language that says even if it's a values-based, you don't want to wear, then we are allowed to say to that family or those families, again, I think I want to be clear, a medical issue or potentially students experiencing disabilities, those are different conversations and processes. But if that is the case, then that would be a conversation we would be having with both student and family about staying in the comprehensive distance learning model.
Okay, thank you.
The next part we have not, so response to outbreak, I am going to give kudos to Jason Clark, Angela Billman, really have been the lead, even with Emily Menser in building this. We are getting better at this. I hate saying that, but we work really closely with Polk County. So have just done a good job of how do we prevent and plan, what is our response, and how do we recover and reentry. I also give lots of credit to our building administrators and to our staff. Again, they're transparent with us. The flow of communication is very positive. These are hard conversations, but again, very appreciative of everybody as we continue to work through this. And this will be a big part of that, but not changes here. No changes in our equity. Again, I will say I'm honored to work, and Rosa Diaz, who may still be on this, she co-chairs with me the District Equity Committee, and we're making progress. But I think really, as we've shared from the beginning, we know the disproportionate impact of COVID specific to Black, American, Indian, Alaskan Native, and our Latinx community, as well as some of our Pacific Islanders. So again, this is a big part of what we're doing in the district, and we know that a lot of our decisions are based on this, and we'll continue to develop that. And just am so thankful for the leadership across the district, both in our classified license and administrators who are, and then I'm going to also say our board members who are part of this process as we build. Not a lot of changes to the instructional model. So again, with what we have built over the summer and what our administrators and our community committee have done, that's there are not a lot of changes. I think one of the key changes is that it clarified that regardless, we have to have a comprehensive distance learning in the event of an emergency closure. So that just clarified that. And again, also then that as we make that local decision operating, that we have to be using and looking those at the advisory metrics. I think the other section is family and community engagement. As I've shared, we continue to have community committee meetings. We have about 75 members on that group. It is staff, it is union leadership, it is board representation, it is parent, family representation. So again, we're doing that. We were doing that monthly. We're probably going to be doing that twice a month. We have another meeting next Wednesday. And then I give great credit to Director Heilman, who has, with our building administrators, they are starting to open up our after school programming. So we're continuing to build on that. So no changes in this.
Hey, Jen,
yes.
I had an opportunity to ask you about kind of what the output was of the community meeting that was last week. Can you just kind of quickly give the board the synopsis of that meeting last week?
Yeah, we did a lot of the metrics similar to what you did. One of the questions that a couple key things we were asking, just some general questions like what are you concerned about? What do we need to be concerned about? One of the big questions I asked them is, as we talk about dates, because we had done a date early on. We had a community meeting, and the community, and I'm going to say parents. I'm not going to say our staff, because there are times that our staff are both parents and staff members. So I remind them to put both those hats on. But in conversation with our parents, they said several months back, Jen, unless you are certain with a date, please don't say a date. Please don't say a date. It's false hope. I've talked about that with those concerns. So I've taken that to heart, because this is a community that is helping us drive decision making. Last week, that was one of the big questions that we asked. We go into breakout rooms, and the big thing coming out of that was, Jen, if you don't have a date, we understand. Can you give us a framework of time? And so we're going to talk a little bit about that at the end. Can you give us a framework of time of what that looks like? We also talked a little bit about transportation and some different ideas, because we do have, as we bring kids in, we know that we can't have the same amount of kids on buses. So we had that type of conversation with them. And just, again, continue to be very transparent with that group. We have added in a few more voices of parents to that group, and we'll continue to do that as we move forward. So again, I think we have great community members and staff who, they're not there to be yes people to us. They ask really hard questions of us as we do the work moving forward. But that was one of the big pieces I needed clarity on because of some of the information that we're getting from the community across and how we move forward in opening up and what that might look like with a metric that is continuing to move in those directions. We have not, and I'm going to say this, our staff have done amazing things with the mental, social, and emotional health. I can't say enough, everything from what they're doing in the morning meetings with our elementary schools, to both at Talmadge and Central High School in their advisory groups and how much they're focused on and helping students have strategies for their well-being. And so again, the website here that it really has been built by Britta and her team and the staff in the building. So again, that's just one of the areas, one of the 8 areas. And then the last one I just want to hit on was staffing and personnel. And again, emphasized in the new guidance that we are required to train, and we have been doing that. We'll continue to do that throughout. That can look in different ways. We've done webinars. We've already built some online videos. Our elementaries and secondary buildings are starting to do that as well. So they have those consistently, not only as a district-wide, but in the buildings as we continue this work forward. I think one of the things, and I'm just going to share this, in the guidance, and it was sort of riddled throughout it. There was language that says you need to have your unions as voice. And clearly we, again, since July of last year, as we started these committees, our unions and our staff and then our families have been integral in this. And so again, I think we have taken some great steps as a school district, because clearly their voices have not, at other school districts, have not been at the table, and I'm grateful. Doesn't mean that we don't have really hard conversations, both in those community meetings and with our meet and confers with the unions, but we have to, as we have talked and will continue to talk, we have to collaboratively do this together for the success of our school district, both short-term and long-term, as we work through this. Then, and Steve, I want to sort of have you help and tag team this with me a little bit. Sure. We are still working through some of the liability issues. So when the governor released on 12/23, the metrics became advisory, no longer mandatory. We did have a House bill that covers the school district for liability insurance. But when this became advisory, there's some issues with the guidance, or excuse me, with the bill that was passed, that is law, that says we are required to follow everything in the Ready School Safe Learner. So it was articulated to us that make sure in all of those 8 areas that you have everything that is stated as required. You can document and have that. Jason Clark, again, he's building sort of what I call the Ready School Safe Learners Division 22. We are building documents that show all of the requirements that we have in place as we continue to move forward with this. So this is still, and I'm going to speak specifically to the board right now, both myself as a superintendent and as you all as the policymakers and fiscally responsible with me in these pieces. These are hard conversations, and a lot of my conversation with Steve this past week and a half has been around this and having those conversations about, okay, where's our risk? And as we take this risk and we know that there may be any type of catastrophic thing that happens, it can put the district in a pretty, from a liability standpoint, in a really bad position. So please know that this is a continued conversation. And again, I know Steve asked that conversation last night of OSBA. I continue to have conversation with our legal counsel as I work with the buildings and moving forward, and have had some conversations. I'm feeling much more confident in the direction that we're going based off some conversations today. And then I'm just gonna, Steve, if you would like to share anything with what was shared last night from this perspective.
Yeah, I'll do my best. This can be a complicated topic, and Jan, when I finish, jump in and clarify or add if I missed anything. And we did have Jim Green on the call last night, and Jim's an expert in this stuff. He was telling us that Pace, when they went to their reinsurers, the Lloyd's of London's, they did not get insurance coverage for communicable disease liability. This was back in the summer, and this was happening nationwide. That in turn led to a very concerted effort at the state, and I think every state's been doing this, to try to get the equivalent of a House Bill 4402 in place, which basically protected the school districts if you abided by the guidance of the guidelines of the state. That bill passed, and 2 days later, the governor announced that we were moving away from guidelines to advisory, which effectively removes the protection of this bill. So the bottom line for any district in the state of Oregon now is you have to manage the risk. And we always manage risk, but you have to be being very diligent if you're going to reopen schools to do all the things that we've been talking about tonight, and maintain those throughout the course of this disease, and effectively just manage your risk. It becomes a risk decision whether we open up or not. There is no liability protection from PACE, nor a House bill like this. That does not mean to say that we hide behind that and we don't make decisions and we move forward. What it means is that we have the responsibility to ask the tough questions and to make sure if we do begin to open up schools that we've followed every requirement and reviewed every recommendation and have really done a thorough job of planning our reopening in order to mitigate that risk. So that's kind of the summary from a board perspective. Jan, anything else that Jim said last night? Jan, you're on mute.
Sorry, can you hear me now?
Yep.
Okay. The only thing I can recall that about last night that perhaps you didn't mention was the strong recommendation from OSBA that parents sign an acknowledgement statement. It's not a permission statement, or anything like that, but have them sign that in spite of the risk, they acknowledge that they still want their kids to be in school. So that would be something for the board to consider, is if we want to do that. But he stressed it was not a liability sort of situation. It's just an acknowledgement. It's not like giving permission or not giving permission, just acknowledging that there are risks for their child to attend school. And the other thing that I recall him saying is that with the on-site testing, there's for false positives and negative types of results, the school is not liable for those tests and accuracy.
Yeah.
Ben, I see you have your hand up, so go ahead.
Yeah, I just want to jump in. So I'm on the OEA board, and so I know that board members, we hear a lot about being fiduciaries, and you know we are responsible for the financial health of our boards and the organizations in our charges. And I think it's important for the community to know that your board is ahead because they are even having this discussion right now. There was a school district, I believe it was in Eastern Oregon, that opened, I'm trying to remember the name of it, I should know that off the top of my head, but they opened, then realized that they were, you know, they had very high case counts. They had made a decision as a board, we're going to ignore the metrics now that they are advisory. They opened their schools. And then when they learned about this situation, they had to go to their community and say, we can't afford the liability, we're closing again. And that's really bad for kids. And that's one of the things that Dr. Kabista had reiterated over and over is we do not want to open and close. So the fact that we are being really thoughtful, not just about the safety, but the liability implications so that we don't put ourselves in that kind of both fiduciary danger and put our kids in health danger and then the mental health danger of opening and closing. I think, again, it's another thing that sets us ahead of a lot of districts in the state.
Yeah, thanks, Ben. Yep.
Thank you.
So questions about reopening before I go into what I'm going to say is really the steps that we are wanting to, and what I'm going to say is that the community shared the timeline or framework of opening as we do that. So any questions as we continue down this, and again, for those of you that Ashley put in the chat, they're also beginning to engage students as leaders in the process, specifically with the videos and different things of how they can help, you know, students seeing students doing it is a really good approach as we go through and help students come back into the buildings.
Yeah, the only other thing I'll add from last night's meeting is, you know, talking through this with other districts, kind of realizing the work that's been going on here, realizing the partnerships that we do have within the district reflected by, you know, everybody that's meeting tonight. And Jan and I talked about this. We left with an air of optimism that we can figure this out. There is a path. And, coming into the meeting, we were just like, oh man, not quite sure what to expect. But coming out of the meeting, it's like, you know what, we can do this. And so, for what it's worth, I think we're on the right path with so many of these things. It's just now continuing to work together to, start the phase back in when we think that's, it's really time.
And in addition to what Steve was saying, a number of the members of that meeting last night were, in a professional way, quite envious of what Central is doing already. That several of them were wishing that they could have the cooperation of the union like we do, and the cooperation of the principals like we do, and many, many parents. So that was a little bit surprising that actually that we're leaders and we didn't know it. So I'm where Steve is. I feel some optimism that we can actually do this when we absolutely have a plan and we know where we're going. We're ahead.
Thanks, Jan. And again, I will continue to say this, and I know that at times these are really hard decisions that we are all having to make. We have an amazing team here from, again, our leadership, from you as a board, from the leaders in the building, from our union representation, from our staff, and even the students, because I know our staff and our principals are getting information from them of we move forward. So I am thankful for that. And then again, the voices of our parents that continue. And again, whether in agreement or not, right? The voices, and I will continue to say that as a superintendent, we will listen to all the voices. We have to make very difficult decisions, but that's what we are trying to establish here in Central School District. So I thank you for that, Jan. Okay, so I know this is a busy slide and we did our best to try and sort of timeline out what I'm going to say a framework for what this would look like. So we have been sharing out, from the last board meeting, some guiding principles. And then as we've been communicating out both on the website and to community members of sort of what the next couple weeks look like, I'm gonna continue on that theme as we move forward. And then I'm sure we'll have questions moving forward. So obviously we're in the week of January 18th. We're in the meeting. We received the guidance and we're having that. Moving into next week, we will continue to, where I need to update our blueprint in collaboration, really Jason Clark and Emily Menser are helping me with that. We believe we'll be able to begin to anticipate, or we anticipate that we'll be able to share more details. Now, these 3 bullets that I'm going to address, I want to be clear. This is not an order, right? It's not this, then that. It is continued conversation with the leadership of our buildings and our principals, the continued conversations with our union leadership, the continued conversations that the staff have, because again, we know that staff are in different spaces and we're trying to continue to move forward. So we are looking at, and again, Kim has shared, we have plans and had started some plans. So the areas that we're looking at, and we are going to start in again, and I'm going to take a minute for limited in person. So limited in person is the step that we can start to take. We are over the 350 mark. We're at 460. I'm going to highlight though that we are moving and decreasing. So that has been some of my conversation with Polk County. We're decreasing. That is helpful as we look at making decisions over the next few weeks. But our approaches are again looking at some of the targeted students at K-5 that we do need to get in. Again, for example, when we originally started our limited in person, we were focusing on the students that did not have internet. We still know students are having internet issues, for example. We also are looking at things like attendance. So there's different moving parts that we continue to look at. I'm also going to say that second bullet, our principals have done such a good job. And I'm going to speak specifically to our elementary principals about their leadership and reaching out to parents to see where they are as we continue to build what this would look like in our buildings. So we've also talked about, and again, that limited type, let me go back, apologize for that, that limited in-person, again, that 2 hours a day, because of where we are with metrics, it's going to take us time to move, and again, why we spent time today. But how do we get that limited in person at grade level? So again, our principals have done a phenomenal job of gathering that information from families, and we'll continue to do that as we move. And then also conversations about, you know, what does that targeted for specific students that we know are struggling, both at the 6 through 12. I had a pretty good lengthy discussion, for example, with our principal surveillant at the high school. We know that we need to we've got to talk about seniors a little bit here. So again, some of those conversations that we're continuing to, you know, build. And I want to be clear, this is not this is first, this is second, this is third. This is continuing to look at the metrics, continuing to work with our union leadership, continuing to work with our building principals, and collectively everyone working together to slowly move into these different types of limited in-person instruction, which is no more than 2 hours, no more than cohorts of 20, which again, I'm not sure even that with where metrics are, we would even be in that direction. And those are the continued conversations that we will have. We're going to continue. We have a meeting next week with our meet and confer, which is times that I meet, or leadership of our school district meets with several leaders who are the ones on this meeting today. So we'll continue to have those conversations. We already have with the CEA a really good memorandum of understanding for limited in-person instruction. So we have already done a lot of these pieces to continue to move forward. I want to be clear, that doesn't mean that we're not going to have things that will come up that we'll continue to address. And that's why we have these meet and confer meetings with both of our unions. And then, as I shared, we're going to have a community meeting on the 27th. The lower part, that is for both of these weeks, we are continuing to monitor the cases and test positivity rates as shared this evening. We are continuing that planning for staff vaccination when it is ready. Again, I think we heard good things. I think I'll have good information tomorrow. I'm hoping I might be able to, we'll see what we get. But I'm hoping we can do a large group this next week of our educators so we can move forward. And then we continue to meet twice a week with our administrative team. One day is specifically the district leadership with only the building principals. And then the other part of the day is all the administrative team across the district, including our managers, transportation, nutrition services, maintenance, and facilities. So again, this is what this 2 weeks looks like. Again, you're going to see February 1st we have a board meeting. We'll be able to continue to share. Again, we believe we're beginning to share and continue to update where we need to share more details. But again, these are the areas of beginning conversation to get students back into the buildings in that limited in person. Again, 2 hours, cohorts cannot be bigger than 20. Kids cannot be in more than 2 cohorts. But again, with where our metrics are, I don't know that we would be in cohorts of 20 at this point as we start to move back in that. And so again, these are conversations. Again, you'll also see a bullet here that says transition to on-site operations within the buildings. And this is that continued conversations with our union leaders and staff. Again, as we do have staff in buildings that are coming in. We know as the vaccines come, staff will feel more comfortable. So again, how do we begin? Because we know we are going to start with the vaccines to transitioning those on-site operations back into the buildings. And again, that's a big part of this continued movement together to not only make sure as we bring everybody in, that everybody is safe and healthy and that we can stay open. And then again, you're going to just see that sort of trend. We're going to continue to have these areas that we're looking at as beginning steps, continue our conversations with our union leadership, and that continued transition as we get the vaccines and moving forward that week of February 8th. And then at the bottom, you can see those through lines, monitoring those test rates, planning for the vaccine, because we do know it's probably going to take through this and continuing that process, especially as we're going to probably have to stage that in based off of what Polk County shared tonight, continue those administrative meetings. And then we will continue training with our staff in safety protocols as we move forward. So I know, again, I am working with the community committee of give us a framework, Jen, of time. And that's really what this is. We believe in this framework, we can begin to, again, and I want to be clear, the monitoring, the cases, the test positivity, that is still always part of that conversation that I continue to have, that Jason continues to have with the health county, or excuse me, with Polk County Health as we move forward. So I just want to, again, framework. So sort of next steps, where we are with meetings. We're going to continue with our Polk County Collaborative because that helps us get to the vaccine and those processes and doing that efficiently for not only our staff, but Polk County, because we have to do it collectively together. We have a follow-up meeting with our community. We'll again be continuing to share metrics. We will start to share more about safety protocols because we know that's an important piece for our families. We have a board meeting then on the 1st where we will continue to share. We may have more information with possibly more solid dates by that time. Again, with everything that we're looking at, we are, again, that transition to on-site operation within the buildings, that February framework as we continue to move in that direction. And then again, as we shared, how do we share more details about that timeline of bringing students in? And again, from that limited in-person approach, no more than 2 hours, cohorts of 20, no more than 2 cohorts. But again, it's on that shorter basis in moving and supporting kids to get them back in the buildings. And again, you're going to see that February framework based off the metrics. So
Jen,
I'm going to pause, and I'm sure there will be questions.
Yeah, and you and I have been going kind of each time we've talked, we've been talking about framework versus, I think the way I phrase it is, putting a tentative date out there and you monitor basically these same things. And then as you get closer to that date, maybe you're a week out, you say, we can go or we can't. And of course, you're going to monitor that all the way up to the date. I'd like to get kind of a sense of the group here. Is that something that we could work towards? I mean, I was trying to think when the governor came out before the holidays, changed everything to advisory, I think she had said February 15th as its targeted start date or targeted date to start getting kids back in. And then when we were talking with Polk County, I was just sitting here trying to think, okay, what if we set a date like March 1st? Could we get through all the vaccinations and actually, feel like all of the, potential no-go signals we'd actually have overcome because we've got the vaccinations done. We can actually with confidence say that we can go. To me, it feels like that is the right time frame. It's like start limited in person mid-February, worst case March, but I think we need to kind of push ourselves to get some type of a target date like that we're all working towards more crisply. And if we can't, we can't. But I think the community is obviously, they're pushing us, a lot of voices. And I think, well, I like the framework approach. I think we need to push ourselves a little bit towards a date. So, I mean, let me open it up to maybe other board members and then union leaders, then admin. And I mean, Jen, you and I have talked about this.
Yeah,
so
absolutely. And I think this is a good time. I'm going to stop sharing so I can at least see everybody. But again, if I need to pull this back up, we can. So I'm going to stop sharing just to have that conversation. So
I can add something, or I guess my thought process. Obviously, I totally agree with how well spoken Steve was. I feel like we need to give some type of targeted date right now and for a while. I feel like a lot of our information that's coming out is like on spin cycle and it's broken. and a lot of it feels regurgitated, where people might be in robot mode and there might be a sentence that's changed, and it's a good important sentence, but just the information is just, you know, just being regurgitated, even though it's not specifically. So I feel like giving the community, parents, students, and staff something to shoot for that's concrete is a terrible word, but that it's floating out there in the distance, that we know we're trying to plan to get to this point. Even if it changes, we still want to be dreamy and want to get from here to here with all the best intentions, all the teams, all the communities, because that will think it's, I mean, I think that will help people think this is what we need to do. This is what, and we'll just have to see.
I guess I can chime in. I was sort of sitting here trying to think how to do a summary like Steve did at the board meeting at the end of everything. And I picked up on a few things. First of all, I agree with Steve. We as an organization can do this. It's not an insurmountable mountain. It's something that we have the ability to do. And then secondly, just based on Kim's comments and some other things that have been said and the presentation, we are ready. Or at least we're ready enough. If the green light came tomorrow, we could get started pretty quickly, I think. You can correct me if I'm wrong on that. And so it really comes down to when does that green light come? And the fact is, what the governor did in December was she said, you're in charge of that green light. Now, that comes with an added risk, because if we make that call wrong, then we're putting more risk on our student body and on our staff than somebody else might be. But the fact is, whenever we make that call, it will be a risk, and it will be us making that call. And I guess what I would encourage us to do is to get comfortable feeling uncomfortable, to be ready to make that call when we think we're not quite ready yet. Otherwise, we'll find ourselves mid-March trying to check off the last possible thing that we can think of that would keep us from doing it before we started. And I think we'll, if we don't miss the boat, we will certainly upset a lot of people by doing that. So my input is lean into the uncomfortable a little bit and get ready to go a little sooner than we feel like we're ready. Did I make everybody go quiet, or?
No, I'm actually just, I'm really processing what you said, and I do agree with what you said. We do. I think it's important to get a timeline out there with dates. And no matter when we open, even if we open, if it's not, if it's next year, it's still going to be a risk. And so we just have to decide when we're going to stick our toe in the water and say, okay, now's the time. So, and I think communicating that out to parents, staff, and students is really important, because they can help us get to that goal. You could say this is our goal, but these are the things we need to do to get there. We need you to socially distance. We need you to wear your mask. We need you to be diligent. We need to, we need it to be as safe as it possibly can be when we allow you to step to the front doors of the building. So, yeah, I think I agree. Yeah.
Well, I certainly agree that a time, even if it's altered, is important for people to look forward to. If we do put out a time of, I'll just pick a date, February 15th, it has to also be with a very clear communication that it could change. But everything I've heard from people say so far, I agree with. Something to look forward to, something that we can focus on. And what Dawn said about getting comfortable with the uncomfortable, we're not there's going to be a number of people unhappy with this and a number of people happy with it. So we need to go with the data and with an organized plan that's supported by the major players and put out a reasonable date.
And I want to just acknowledge, Steve, just so you know, Jerry's put up, because I know he's having audio, just can we shoot for the February 15th? So that was, I just want to articulate that on record for him as one of our board members. So thank you for that, Jerry.
Yeah. This is the crux of the meeting, everybody. I mean, it's like, you know, if we could pick a date and we all are agreeing that that's the date to shoot for, you know, we know that we've got risks. We know we got things to work through. I have said from day one that we gotta, when we get to this point, we need to be together on what we're communicating, that we all got into the agreement in the same mindset. I had hoped that the vaccinations would have rolled out in this February 15th date. Kind of would have been a no-brainer. So the problem that we've got is we've got high case rates, we've got delays in the vaccine, we got a community that recognizes the kids are suffering, we got a lot of staff that want to start, and we're trying to, you know, mitigate as much of the risk of being completely prepared. So I think we're close, but we've got to really talk this through and make sure that we're in this together. So Ben or Chris, where are you guys at?
Cindy, I'll let you jump ahead of me, and then yeah, I'll share kind of the way I understand the union's perspective on that, the CEA.
You know, as far as the union, I feel like we are ready to go to work, and I know that there are people who don't want to have shots that but they still want to work, and they know the protocols. So, and I've talked to lots of transportation and a lot of food service, and I know that there's a lot of other departments too that are classified. And I feel like I need to go around to each department and see what they feel like maybe they need, just as their union rep. I feel like that's important, that makes sure we've got our bases covered there. So I am going to work on that.
And then Denise, I see you have your hand up too, so I'm going to acknowledge that as well. So please go ahead.
So I'm going to play devil's advocate here. In looking at the calendar and looking at the required doses of vaccinations, I don't see where a February 15th date would be realistic. I agree that setting some sort of a target date would be good, but I think in terms of the comfort of employees, I think we would have more employees willing to come back and be comfortable coming back if they could at least get both rounds of the vaccine for those who want to take it. That's what I'm hearing, is that folks would want to have that that completed. So we would at least be looking at 30 days if everyone was able to get their vaccination tomorrow, which we know isn't going to happen. Yes, there are those of us who are comfortable being in the building now, but would those folks be just as comfortable when you add students into the mix? Right now, we are quietly working in our own cohorts in our buildings, and so we're working somewhat separated. So I'd just like the board to consider that when we are talking about potentially setting a date, when we still are very unclear when we will actually be able to start the vaccinations based on supply.
And I'm going to just follow up on that because I think that that is something that I absolutely agree with Denise. That's something that we need to consider very seriously. One of the things I have said to every kind of person in power that I've had a chance to talk to, from the governor to you folks, is the people who are calling for schools to reopen will not get your back when someone dies. Those people will vanish and it will be all your fault. So please don't think that that public pressure is going to be supportive if it turns out we started too early. It will totally flip on you. And so we have to, there is going to be some enduring of some anger that is not based on metrics, that is not based on reality. There are people who are fatigued already, and they're saying, we just want to open regardless of what the metrics say, regardless of the safety. And I've been really heartened and pleased by the fact that this district has not taken that approach, that we are taking safety seriously. We are so close. We could have vaccines for our people in the next 2 weeks. That then starts the clock ticking. It takes about a month. We would be looking at mid-March.
Mhm.
If we rush and say we need to open, 2 weeks earlier than our people are actually protected, how are we going to feel when somebody gets sick in those 2 weeks? And we could have waited 2 more weeks and had that person be inoculated. So I know that it's going to be hard to deal with people in the public saying, but I want my kid to start on March 1st rather than March 15th. And we are going to have the wherewithal to say, we have made a commitment as a district to be safe in the way that we do this. And I know you don't perceive this to be unsafe necessarily, every single member of the community, but we are being thoughtful and cautious and safe. Now, that being said, we've got people, we've got members who are saying, I want to be in the building now pre-vaccine. And when we talk about limited in person, we are talking about some circumstances where we could have cohorts of 6. If we can staff those with the people who are making that choice voluntarily, I think that is something we are amenable to, we're open to. But we don't want to put a date out there into the public that is before our people are vaccinated and then find ourselves in a circumstance where we can't actually staff it. That would be really bad in terms of messaging for the community. It would make us look disorganized. It would make us look like we've got infighting going on. We're much better off to say, we've got a date that's like March 15th, *****, and explain to the community, if we get the vaccines, if the metrics come down, if all these things, this is what we think is a realistic date. And I know that will be hard, and I know that will be very hard for people to hear, but trust me, it's a lot harder to have to deal with death that we cannot take back.
But nonetheless, it is a date, and it is something that we could put out there and say, this is our target, and this is when we are feeling most comfortable bringing students back into schools where it would be safest for them and for our staff and for our community.
In the meantime, we begin where we can some limited in person, right, with the staff that's willing to come in where we need it the most, and we say, that's an earlier date because it's it's a different scale. It's something that we can do relatively quickly. In fact, we were
and I
kind
want
of on that. Go ahead, Jen.
I want to just clarify that because I think I want to be clear about 2 different pathways. Right. I think the pathway of, and I'm going to articulate what both Denise said and what Ben said, and a little bit what Cindy said. It has been articulated to me from both unions and even from our building principals. So I want to be clear, right? This is a collaborative, continued conversation that there are some staff that would be potentially willing to come back. Because of that, again, in and I'm going to talk specifically for our elementaries, but I know both Donna and Perry are going to and will continue to have these conversations about how might that look as we do that. Because again, that advisory metrics, we can't really talk about anything further than limited until we're under those numbers. There are other risks, there are high risks to that. If we're at 460, I want to be clear as a superintendent, I am not in favor of having a hybrid model, but am I in favor of limited in person because I believe that we have good buildings that have good conversations with the leadership here that we could move in that direction, you bet. But I think that's the piece, is that advisory metric in that red to yellow, excuse me, red to orange to yellow to green is still part of that process of how and time, or how much time that we would have. I think we do have staff that would be willing to move in, I'm going to say mid-February-ish, to some limited in-person. But again, I think that we have to, anything of moving towards a hybrid where there would be kids in buildings for a full day as an example, we cannot until the advisory metrics drop. That would be putting us at great risk. So again, I'm just going to say, and then I want to look at Carol and then Van, but just in that piece of mid-February for a limited in-person approach, I think that is a good metric that we could look at. And then again, I'm going to be quiet and let Carol and Van and then the principals talk. But I just want to articulate about the advisory metrics. That is still part of this very large conversation.
Good clarification. I was getting that a little bit confused. That's.
Yeah, most of what I was going to say has already been said, but just that using a date range rather than a very specific date, so that we can have qualifiers depending on the metrics and vaccinations at that time. I would just be more comfortable with a date range personally. And if we stick to a specific date, then I think we might be held to that in some ways by the community.
Van, you want to jump in?
Well, it's kind of a pretty good segue. I mean, talking about a date, it kind of takes me back to when we first started the distance learning last spring, and especially at the beginning of the school year this year, where the focus and the communication between the administration, especially at the high school, was please be flexible and extend grace generously. And we've kind of carried through that, and the administration have been very flexible and extended grace. Teachers also have been doing that as much as possible. I mean, it's tough. And also we've asked that of our students as well, to be flexible. And, you know, I'm horrible online teacher. I am. And the kids have treated me so gracefully. I really hope that if you all decide to set a date or want to do it in this range method, that the community also values the ability to be flexible and to show grace, because there's so many moving parts and there's so many different variables that in order to move together, we have to be flexible and have to show grace to each other, because these are really super, super duper hard decisions. And they're really critical for the health and safety of our people, all of our people. So I would just hope that the community buys in and is flexible, whether we have a date or not, that because there's so many variables, please be flexible and show grace to everybody who's involved. Thank you.
Anybody else want to jump in? Kim or Donna, Perry, Ashley,
administrators, jump in.
Nicole?
I would just say I appreciate everybody's thoughts and how people are sharing and open and honest. We've been of course, safety and the health and well-being of everyone in our community, our teachers, our staff, our students are always and will continue to be the first priority. We know our kids, many of our kids are struggling. We miss our kids. It's hard. It's hard for everyone. And we've been planning and we've been planning and we've been planning and we've been shifting. And but you know, I think it's safe to say we want our kids back, and they need us, and we need to be safe.
Yeah, I think we all feel that way. I mean, I see it every day as a parent of a senior who's like surviving, but I have no idea what's really, what kind of damage or effects this is going to have long term. You know, every parent is thinking that way, and we all do this kind of stuff because we love the kids. So Donna, Perry, you guys, anybody else?
Yeah, you know, I've shared with Jen, and I do understand the complexities of trying to manage what we're working from a metrics perspective and fluctuating numbers and risk. And on the other side, from where we come from as administrators from a planning end with a moving target, it's very difficult to really truly, you know, when people say, hey, could we implement that plan tomorrow? It's helpful to have a vision of when it's going to take place. And so, you know, we're trying to balance both parts of that equation. Some of where I come from as a high school administrator is that with our seniors, this is very timely. We have seniors right now who are not passing classes, where if we can get them in for some supports right now, we could potentially get them to pass. It's very different to provide that kind of support than it is to provide later on a credit recovery sort of situation. So some of this for us is quite timely in trying to determine how we can make this work, and some you know, conversation around. I guess I'm just saying I want people to be aware that there is truly a sense of urgency for me as a building principal. For a lot of our students, there are opportunities to, you know, do some robust summer school. Our seniors are on a really tight timeline for something that's going to impact them for the rest of their life. It's really important.
Well, I'll take a stab at summarizing, and then I know it's getting late. So, you know, I think we're all wanting to be kind of moving in a direction of getting the kids back in. From a limited in person, mid-February, let's at each level move forward with plans for limited in person. We don't have to pick a date, but mid-February, and this is the priority. We're doing that as we're monitoring and working through the vaccines. You know, any type of, you know, more than limited in person would not be any sooner than mid-March, and that's going to be based upon everybody that is in the buildings having the opportunity to have the vaccine twice, and the case rates coming down closer to 350 or below 350. I mean, and that later date, I mean, there's a lot of uncertainty still on both those things, but at least, you know, being able to say, yeah, I mean, we've worked through the vaccine, we've worked through now this new guidance, we understand it, we're in this together, we're starting with the limited in person, we're going to target it where it's needed most, and then keep working on the vaccine, keep working on the county, understanding what really is happening with the virus. I think that's where we're all at.
I was just going to reinforce what Van said. I think as we move forward, I agree with everything you said, Steve, but as we move forward, we know that there are things that are going to go wrong and things that won't go according to plan. We will make decisions that will, in hindsight, look bad. And we all need to give each other grace in doing that. So when, you know, the first outbreak happens in, I don't know, pick a school, MES, you know, we can't all jump on Kim and say, you messed up. We're all in this together. We all need to have each other's backs, and we need to give each other grace and remember that we're all trying to do the same thing. We all are trying to get the kids back in school in a safe manner. So let's go for it.
And Don, as the superintendent, I appreciate that very much, because I want to be clear, that will probably happen. A cohort will go down. A staff member will, you know, will have to figure out a plan because that staff member may, again, get it. Again, if we're working through things, especially if we're limited in person. But again, I think I want to be clear. I appreciate that. And I am also going to echo, as the superintendent, with what Van says. I think we have an amazing community first and foremost. Let me state that. I think as we move forward, there are lots of moving parts, and the grace and space as we do this. I have, again, the utmost respect with what our principals, with their staffs, with all of us. Again, our administrators are amazing in the fact of what they're advocating for their staff and their students. And I need to say that as a superintendent. And I also know what we do behind the scenes collectively. But I do want to reiterate with what Don said. We will have those situations happen. I hope that we are wrong with that, but that is the possibility that those will take place, and that we'll have to continue to work through those. But I do think with the constant conversations that we are having, the beginning of limited, and I'm going to say that again, the beginning of limited in person, and then continuing to where we can build on the limited in person at every level, and continue to, and my admin team and our union leadership hear me say, we go slow to go fast. We need to go small to go big. And that has been a lot of our conversations of how do we start? And again, we had to start. We learned a lot in 2 days, elementary principals. And Jason, I'm going to say that, whether you believe that or not, the 2 days we had limited in person is helping us immensely to as we look at mid-February and moving forward with that. And then continuing to have open and honest conversations, not only with our administrative team, but our union leaderships, and continuing those processes, because the vaccine is going to happen. I'm hoping that we will be able to get some information out tomorrow to staff, again, based off of what Jackie shared, and then a couple text messages that I've received this evening as we talk about a meeting tomorrow of what that might look like. So again, towards next week, I want to be clear, not tomorrow, towards next week in the vaccine process for our staff. So thank you.
Awesome. Jen, did you have any other slides or any other next steps, or is that basically it?
Well, that was it. It was, again, wanting to share. I do think, we can continue these talks. I think mid-February, and again, this is probably, this group, this has been a continued conversation, but I'm going to go back and I'm going to, originally when we started, I've talked a lot about phasing in. And I'm going to use Van's word. When we first met in, I think it was September, he says phases and stages, and we're continuing to try and build that. I think our principals have some really good plans and thought processes at the elementary. What's the first phase? What's the second phase? I know conversation with Donna, conversation with Perry, and as they continue to have those conversations with their buildings of what can we do, who is ready, and then continuing to move forward. But again, that grace of things and knowing that things can happen and that we just want to be aware of that. And that is me as the superintendent. We collectively make these decisions together, but I also know that there are days that I have to make hard calls and we'll continue to gather information. But I think we feel comfortable. And again, I'm looking at my leadership across this district. We feel comfortable with those steps of looking at that mid-February, and then continuing and starting to share what that might look like out. And with that.
Great.
Can I just ask for a favor, and you can tell me if this is selfish on my part, but if we put out anything with any dates, I think it needs to be written in such a way, it needs to be framed in with a recognition that we are putting this out to a readership that is dealing with an irrationally high level of anxiety. People are scared right now. And so one of the things we have run into, and I'm looking at some of our administrators, and I know you know this intimately well, the administrators can ask in the most innocuous, innocent language to one of my members, would you feel comfortable coming back into the building? And I get a call that day saying, I felt pressured. Like, people are just so nervous. And so I think we really want to write that in such a way to not only talk about how we are going to need grace because these dates could change, but also reminding staff, reminding parents that all of this is voluntary, that that they have flexibility, that nobody is going to be put in a situation that makes them unsafe. And I think that needs to be stated kind of over and over, so that before I get that call from the person saying, I just read that I'm going to be forced back into the building on February 15th, and I have to say, look down to the bottom of the page, there's a tiny thing in 10-point font that's an asterisk that says not you. Like, if we can make that really clear to people, this is something we are easing into with the staff we've got, and with the parents who feel comfortable with it. And we are moving then slowly toward, increasing comfort as people see that with the vaccinations, with the way that we do things, we can do this safely. I think writing it with that sensitivity to people's anxiety in mind will sure help me avoid a lot of phone calls, and I would really appreciate it.
Very selfish, but very wise. Thanks, Ben. All right, I think we're good. What do you think, John?
Yeah, I mean, again, I think this is, I will say this, and I look at everybody on this, and even including you as a board, we as educators, this is not what education is. I'll say that first. And so this has been very difficult. Again, I am thankful for this team. I appreciate the transparent conversations. I know that those will continue. At times we agree to disagree, but we're continuing to be at the table and have these conversations. I think, I listen to all voices. That is my job. And that, whether people believe that or not, I listen to all voices, and I have to weigh. And I don't usually say I statements because we do this as a team, but there are times, and my administrative team knows this a little bit, that I've had to make some calls here the last couple of weeks, and I'm very appreciative of everybody. And I do think that we will make good decisions in the best interest of the district. We'll continue these conversations with our administrative leadership and then our union leaderships, and obviously keeping the board apprised of where we are and the things that we're moving forward with. So I think we can do this. And again, I'm going to say in a strategically small steps, in limited in person, moving forward and looking at dates in February, mid-February, to start those processes. But again, I want to be clear, it's not going to be we're turning and everybody's going to be in it. That is still a long road ahead as we make those decisions. And we have really good leaders across our district that will help in diving into that and making those decisions. So thank you for that.
Great, good summary. Thank you, everybody, for hanging in there on what turned out to be a long meeting, a very, very important meeting. Really, really appreciate us, coming together and doing this together. So important. So thank you very, very much. Thank you, board, for allowing us to turn this meeting, our PLC, into this, which was, I think, a really good use of our time. So have a good night, everybody.
Thank you. Thank you.
Go get some rest.
Good night.